My name is Willoughby John Olawale. I did my practicum at Best Life Foundation School, stroke Best Life College, Abalabi, Ogun State. I work at the Guardian and Counseling Unit. I actually handle a number of cases, but the case I want to actually talk about is this case of a junior secondary school female student who lives with with her uncle, and her mother. She doesn't know where her mother is, and father is actually jobless and only comes once a while. But the girl is actually a very brilliant student. But the uncle were treating the girl as a second class in the family. So his own children actually have more uh, uh, um, attention than the girl, and some of her needs, especially her academical needs, were not being met. So because of that, I when the case came to me, I took time to observe the girl, and after observation, I was able to have a one-on-one with her with time. Actually, this case was a little bit of dilemma for me because one, if I report the case to the social welfare office, the possibility of the social welfare office not being able to go through and be able to do everything that the girl needs, get her a shot and everything is there. And of course, if the uncle is invited, the uncle can say, "Oh, I'm helping you. So since you have to put me in trouble, then I'm no more interested." Then also the issue of the school is also there. Because if the other parents hear such a thing, they can decide to start withdrawing their children from the school. That this school will go and report us to social welfare. And of course, there's still a need to intervene in the case of the girl so that she can have everything she needs to be able to do well in her academics. So I used the attachment theory to try to understand how the absence of a stable caregiver affect the girl's emotional security, Maslow hierarchy of needs, to understand as psychological, though as psychological and safety needs were met, but the need for love, for belonging, for emotional support was not there, which would directly affect performance and self-esteem. Then I also use the strength-based perspective to emphasize that our academic and our resilience is a mode of empowerment. And since already she's good, that will help her. So how is this theory applied? I use the theory of attachment to assess our emotional vulnerability, resourcing for inconsistent caregiving, instability, and feeling of less value in the home. Then I use the Abraham Maslow hierarchy of need to work with the school to ensure that our academic needs, safety needs, and emotional reassurance were strengthened, since these are the foundation for learning and psychosocial development. Also, I use the strength-based perspective to affirm our talent, reinforce our confidence, and help her to see that our ability can shape our future positively despite the family hardship. So the school actually, after I discussed with the school decided that they're going to take up all our academic needs. So everything she needs, she will be able to get so that she's not put in further risk situation. And the school, since my time was short there, because everything I do, I always carry my supervisor along, and he's always guiding me as I take the step. And of course, I know my time there was short, so I allowed the school to be at the forefront handling the situation. The girl actually received the best students in her class, the best award students at her level during the end of the year section. And I observed that after the discussion, she become happier, and she become more relaxed and pay more attention to her academics. So my role as a social worker, I actually assessed, that's observing her behavior, emotional signal, and academic strength. I also was involved in advocacy, that talking to the school and raising support for the girl. Then also I did counsel and emotional support, trying to build rapport with her, listen to her actively, and help her to develop a positive image of herself. And also, I also work as a resource mobilizer, whereby I was able to ensure that the school were able to get all the necessary, help her with all the necessary things she needed. So my rapport skill was built. My skill for effective communication was also built, and I also learned more in terms of casework management. The thing is just that for me, I believe that the ministry, especially in Ogun State of Education, should make, that's my recommendation, make it needful, or that all in school in Ogun State should have a social work in their employment to be able to handle cases, and also that the ministry themselves should have a supervising social worker that will go to these schools and supervise what the social work in that school are doing. So in conclusion, the practicum has actually deepened my understanding to understand the complexities of child welfare within the school environment. This case demonstrated social work practice requires sensitivity, ethical judgment, advocacy, and collaboration with institutions. Although challenging, the intervention strengthened the students emotionally, ensured academic support, and showed the vital role social work plays in protecting and empowering vulnerable children. Thank you.
Thank you very much, John Willoughby Olawale. Have you heard about a theory called system theory?
Yes, sir.
Did you apply it? Is this something you thought about when you are trying to handle the girl's case?
Actually, I didn't. It didn't actively came to me when I was handling the case, but it's actually an applicable theory.
Because I was looking at some of the issues we are discussing and the theories you were able to use or perspective, and I was actually surprised that you are working in a school setting and system theory did not occur to you. Okay, now that you know, how can, my only question, how can the system theory be applied with the case you just handled?
The girl we are talking about is actually living, let me use the word living, within a system. We have the school as a subsystem. We have the family, the uncle family where she's staying as a subsystem. Then we have the general society as an encapsulating system. Now, when all these systems are able to work together, now it gives the girl a confidence and the level, the basis she needs to be able to achieve what her purpose and become who she's meant to be.
Okay, yes, I needed to ask that question because sometimes we look at some very complex things to be able to solve our problem. But again, time and again, the resources we are looking at, we want to use may be within our reach, but we may feel that it is too common or too simple for us to use. And we begin to go for very complex ones that may land us into trouble or make us not communicate the way we are supposed to communicate. So when we have a theory like system theory, which is a very low-hanging fruit for us to apply in the school system, you have actually made the point. Yes, it is very germane. And again, one of the crime of some social workers is that sometimes they look for solutions where solutions are not, whereas there are things that are very close. We call them low-hanging fruits, where they can explore to solve their problem. Or if they, for example, now they find themselves in a medical setting for indigent client, they now begin to use their money to begin to pay for the hospital bill of client instead of exploring the resources within the client system that can help them address their problem. So that was why I asked that question. So thank you very much for your time. And
To buttress your points,
yeah,
he achieved his Maslow hierarchy by telling us that the student came the best student in the class for that year. So he justified the use of his Maslow hierarchy,
yeah,
forgetting that the system need to be touched before the student can be rehabilitated.
for sure. Thank you very much, Doc. Okay, Olawale, you can take.
Thank you, sir.
I can't hear anybody.
Oh, sorry. Deborah Isa, can you hear me?
Yes, sir, I can hear you.
Oh, sorry. I actually muted myself and I was talking to myself, not knowing that I'm not communicating. Sorry about that. Please, Deborah, General Hospital, Amina. It's like you are the first person that is coming from a hospital setting this morning. Tell us your
Yeah.
experience in General Hospital, Amina.
Okay. Good afternoon, sir. Good afternoon, ma. Good afternoon, everybody. My name is Deborah Isa. I did my practicum in General Hospital, Mina. The clinic I was posted to were two. That is the psychiatric clinic and also the heart to heart. That is where the HIV clients receive their treatment there. So why they posted me there is because the psychiatrist clinic is only twice a week. That is Monday and Wednesday. So they said we can go to the other side the other days. So what I handle several cases here, but I will talk about one. 38 years woman who was married and she became HIV positive after having 3 kids. She fell sick and she was referred to the hospital. She was tested positive.
Cinderella, can you please mute your mic? Sorry, Isa. Cinderella, can you please mute your mic? Go ahead, Isa.
Okay, so when she was confirmed positive and started her treatment, she was stigmatized by her family members. The husband left her without any information. He just left the house and she really don't know his whereabouts. The mother too was stigmatizing her, insulting her that she has gone to do prostitution because the husband is negative. So the lady felt so bad. She started thinking she was doing anything, and the next thing she took pills because she said she had thought of killing herself, because when she was sent to the hospital she was just looking moody, and I have to see her to do counseling for her. That was when she opened up to me and tell me what was on ground, what her family did to her. And she also confided on me, tell me that yes, she took pills, she wants to die. She just feel like dying. Her viral load as of that time was 7 point something million as of that time, because she was not taking her drugs. She stopped taking drugs just because she wants to die. She can't sleep, and that she take alcohol just for her to sleep. And she said she had a lot of thinking. So when I saw that, since I am going to the psychiatric clinic, I also referred her to the psychiatric clinic. She came around Thursday, so I asked her to come back on Monday so that I will take her to that unit. So when she came back that Monday, I took her to the psychiatric unit, and yes, the doctor assessed her there. After assessing her, he prescribed drug for her. She was actually depressed, and he prescribed drugs for her, which she bought, and she started taking after leaving our side. We exchanged numbers and we chat on WhatsApp. I think she just greet me. She just want to greet me. I check on her. How are you doing? Did you take your medication? How's your sleep? And other things. She would tell me that she's doing very well. When she came back in the next 1 month, she was very, very okay. As in her communication, everything was just fine. She was thanking me, even brought some things for me. Then we have to start another counseling again, because yes, counseling doesn't stop in just one time. It's a continual process. So I also asked her mother, how is her mother? I know that time I told her to get something to do because she was not doing anything. She said she has stopped working because she feel anybody that looked at her, they think she have HIV, and she just think that was the end of the world. So I told her to get something to do. Yes, she knows plenty handwork she can do. So I was happy. She said she has started doing something. She also brought some snack because she said she's baking cake and she do all this egg roll and meat pie. So my challenge there, sorry, let me go to challenge. The challenge I encountered there is for generally, not on her. We have shortage of staff there because we only have one consultant at the psychiatric unit and one nurse. Then also lack of awareness. Recommendation, what I will say there should be increase of psychiatric nurses there so that the clinic can flow every day, because daily we identify cases and they have to wait till Monday and Wednesday because they can see the doctor. Then another recommendation is to create awareness, because yes, in the psychiatric unit, I have learned a lot of things. To me, before, I never know there was anything like antidepressant, that somebody is depressed, you prescribe drugs, anxiety, seizure, and other things. I never knew that. It was when I went there. Even the first day he said somebody was depressed, I was like, depression, you are giving somebody drugs. He was like, he laughed and he said, yes, now. I said, okay, and they prescribed drugs. Then what I learned there, hence creating awareness, another recommendation, creating awareness mostly in boarding school, because yes, in boarding school you have a lot of students that have these seizures. All of a sudden you see somebody is running and they will bring them and they will say it's jinn, it's spirit. Some will say people are talking through them, not knowing that yes, there is medication they can take, there's something they can take, not to just go and stay and start praying for them or lock them in the house. So I think awareness is more important in schools and also in churches, for also the malams and the pastors should be aware and everybody around. Then also what I learned is about me learning new thing, that yes, there is something like giving depression, drugs for depression, also anxiety and every other thing. And also I want to appreciate the school for giving us this opportunity to go to places where we don't even know things exist and to learn new things there. So thank you, and over from me.
Thank you very much, Deborah Yusa. I'm seeing your recommendation. Say General Hospital, Mina. I just want to believe we don't want to confuse things. You are recommending psychiatric hospital, psychiatric doctors. Is that supposed to be psychiatric doctors or clinical psychologists?
No, the nurses is only one we have. If they have nurses there, we have one doctor and one nurse. So if they increase nurses there, yes, the consultant can call it, but the nurses can be seen every other person, even when the doctor is not around.
What kind of, because we are talking about depression, we are talking about other disease, and we are making case to a psychiatric doctor.
Yes, that's where they see them cases. There is the general hospital only have psychiatric clinic where they see every other cases, not only the ones that are psychotic, mentally they see both depression, anxiety, everything in that clinic.
Okay, so I want to know, as a social worker, is it getting more psychiatric doctors or getting clinical psychologists?
Clinical psychologist.
Before you talk about psychiatric doctors, you understand, mental health is a middle name to make sure that those who have lost touch to reality are not stigmatized. So you say the person is having a mental health challenge. So mental health is a middle name. When you move towards the right, it becomes mental wellness. When you move towards the left, it becomes mental illness. You understand? So I'm looking at, so if you have people of that nature that pass through depression, that I don't think they have become a psychiatric case, that they will require psychiatric doctors. If you are saying that what is on ground in General Hospital, Mina, is a psychiatric section that also take care of them, there is nothing I can do about it. But I cannot, with my experience, allow you to make a recommendation that those who are having depression or other issues that has to do with trauma should become psychiatric cases. I hope that point is clear.
Okay, yes, in general, it's just psychiatric clinic that we have.
It's all right.
Yes.
Okay. Edem Etidobasi, I don't know. Etidobasi, our
Yes, sir.
class rep or class captain.
Good afternoon,
In
sir.
good afternoon. In other climes, you are supposed to be number 1. They call you 001. I don't know why you became number what here, number 18. But anyway, that is the way the report came in. So, Edem Etidobasi, you did your work at the Children Correctional Center, Uyo.
Yes,
Can
sir.
you put us through to what you have been able to do in Children Correctional Center in New York?
All right, sir. Thank you. So, good afternoon, my coordinator. Good afternoon, Dr. Kemi. Good afternoon, colleagues. My name is Eti Robasi Edem, and I did my practicum at the Children's Correctional Center, Uyo, Akwa Ibom State, between the 4th of June and the 15th of August, 2025. Children's Correctional Center is a facility that houses children that are in conflicts with the law, and both those who have been convicted and those who are still awaiting trial are being housed by that facility. And most of the children, minors that are there, are those that were ordered from the court, while a few others are those that were given mandate from the Commissioner for Women Affairs. So those are the composition of children at the Children Correctional Center, Akwa Ibom. During my practicum in that center, I had a couple of cases that I was involved in. One of the cases is a case I went there to inherit. I think it's a high profile case where a particular student, a minor, a secondary school child, was allegedly accused of luring 2 other children to the stream and drowning them. So it happened that the parent of these drowned children had a little influence and connections, and they really had to put in resources to make sure that they bring this their alleged perpetrator to book. So they involved the police, they involved SSS and a lot other security agencies to make sure that the investigations are right. During my stay there, even though the child was there before I commenced my practicum, I also took my turns in talking to the child and trying to get information about the incident that happened. Because up till the time I left there, even though before then DSS officers have been coming to also interview the child, but the child has been very calm and he has always been given the same answers he used to give in the past, that he wasn't the one that killed the two brothers. So psychologically, when talking to a child, you want to see maintaining eye contact and seeing if the child is going to shake or shiver or maybe mince words or trying to say something different from what he had already said the previous times. But from all the times, both from the interview and the interrogation we used to have with him, and the ones the DSS came in to interrogate him, the boy has still maintained that he's not responsible for the death of those his friends. So it became very difficult, even though the case is still there in the family court. It has not been the judgment has not been given yet. It becomes very difficult to be able to track and to understand if this boy was actually responsible or not for that case. But the history of the case says that he actually went to the boy's house and invited them to go to the stream together, but the two others did not return while he was the only person that returned. So that's one of the cases that I had. Another case that I had was a case which was referred from the children's home in Uyo, of a child who impregnated another girl at the government's home. So the commissioner for women affairs had to order that the child be brought to the correctional center for custody and for discipline. So during that time, I was privileged to take document the child's information, take history, and then manage that case. During the documentation, I discovered that the child was um, actually 21 years old. But when they were sending him down to the center, they were sending him as a minor. But during fact finding, we discovered that the child was actually 21 years old, and that because in the secondary school, he has other friends that are very stubborn, and maybe it is delinquency from friends and the people that he goes around with. Um, some of the one of the theories I use in dealing with the children in the center of the social learning theory, which basically says that children learn from behaviors uh, by observing others, and maybe through reinforcement and punishment, you can tend to correct some of these behaviors that they learned. And then we try to model positive behavior and attitude in them, and then praise them when they do well within the center, as well as punish them when they seem to go wrong. And then we provided opportunities where they can be practicing skills, and then interact with themselves so that they can encourage themselves. Um, on the whole, my stay at the Children's Correctional Center was very, very encouraging, and it's the first time I've worked with children who of that level. And my recommendations would be that these children have been both the male and the female are there in the same compound. The only thing that demarcates them is just the hostel that's staying. And I just took back my head to the case that the one of the cases that we had that at the home, where a boy child had to impregnate a girl child. So I'm just recommending that maybe the facility should be extended to accommodate just um, the male residents, and then the female residents also, so that they would be able to manage them well instead of mixing the two genders together. And I also recommend that maybe other centers should be established in the different senatorial districts of the state, so that it can somehow decongest the just one that we have at the state. Those are my recommendations. On the whole, the practicum gave me a good time to interact with children, and it also gave me the confidence to also forge ahead and know recommendations and ideas when I come in contact with those kind of cases. Thank you, sir, and over.
With your theory, the social learning theory, people learn through observation and through positive reinforcement or praise, positive enforcement. Children can be encouraged to continue with good behavior, while punishment, negative reinforcement, can discourage them from negative behavior. When you were giving your recommendation about gender, so at the time I was thinking, is Etido advocating that we should have more facilities where both male and females are housed together, but along the line you're able to clear that. It was about when you started, I had a feeling that you are trying to talk about separation. But in trying to explain it, I begin to get confused whether you are advocating for having both genders in one facility, but you were able to clarify it towards the end of your statement. Etido, working with Children Correctional Center in Uyo means that you are working with delinquent children. Working with delinquent children. What in working with children of this nature, some will say that prevention will be more effective than providing intervention to the delinquent children. As a social worker, can you identify like 2 or 3 stakeholders that can be worked with to prevent children from delinquency?
Okay, sir. Thank you very much. The stakeholders that can be worked with to prevent these delinquencies, I think the first one are the parents at home, because they are the first teachers of the children, and if anything goes wrong at that point, it starts from the home. If you have a good background at the home level, I think it will help at the larger societal level. The next stakeholder will be the school teachers, the school environment, those that are handling them at the school level. And then we also have the police and then the Ministry of Human Affairs. They all have high stakes on helping these children to reduce reduce their delinquencies and bad behaviors.
Okay, okay, your answers are okay, but you forgot a very important stakeholder. You just forgot a very important stakeholder, which are the children themselves. Because we are going to work on delinquency against children. So children should be an important stakeholder. As we were speaking, I think I saw Dr. Olawale. Okay, yes, Dr. Olawale is here. Doc, good afternoon, sir. At least tell us well done so that we'll continue.
Yeah, good afternoon, the registrar. Good afternoon, the Practicum coordinator, Shoka Ferdinand Moja. Good afternoon, students. I've been listening and I'm highly encouraged with all I've been hearing. Thank you so much. Well done.
Thank you, sir. So at any particular point in time, you need to make input. You know the floor is always open.
Yes, thank you, sir.
Yeah, thank you. Edem Etidobasi, you can take a bow.
Thank you, sir.
Olowo Mary, are you here?
I'm here, sir.
Rural Development.
I'm here, sir.
Rural Development and Community Affairs.
Yes, sir. Good afternoon, sir.
You are welcome.
Good afternoon, sir. Good afternoon, ma. Good afternoon, my colleague. My name is Olowo Mary Oluwasayo. I did my practicum at the Ministry of Rural Development and Community Affairs, Abere, Osun State. And the main work of this ministry, they are to advocate for local governments on their ongoing self-help projects and conflict resolution. they hold meeting with the CDC representative on the development of their self-help projects in their area. They also oversee the planning, implementation, execution, and evaluation of rural development projects. Also, they mobilize resources for rural development projects and inspect the self-help project in the 30 local governments of Osun State. During my course of stay in the ministry, I was able to attend the monthly meeting of the representative of the 30 local governments. They are the stakeholders, chairman, their chairman, their secretary, and others. They used to come to meet the ministry every first Wednesday of the month, and I was partake in the 3 meetings. The meeting was very educative because there are different kind of different culture, different kind of people with different attitude. They were all the meeting was very interesting and educative. Also, we went to Mokore rural area to inspect their ongoing projects. Likewise, at Olode Falola, at Olode Falola, they embark on the borehole, which was almost finished at that time. So we were there, inspect them. Also, at the Olode Falola, I was able to grace the CSDP program of tie and dye project, which was very interesting and educative. I learned a lot at the program. So those are 3 out of the project we inspected. As the skill acquired during the meetings and the programs, the crisis intervention, ability to intervene, to provide immediate and quick response and conflict resolution during crisis and emergency. Also, advocacy. Social worker are learned to speak for people facing injustice. Also, ability to think critically. Before you jump into any conclusion in the community, one needs to think very critical and be patient to speak out on anything. Because we social worker, we are not a judge. So we need to, in any intervention, we need to be very, very careful and listen carefully. Also, organization, we learn the organization skill. Well, as a social worker, one need to be organized and capable of managing cases and ensuring proper documentation and effective planning on any undertaking. Now, as a social worker, one need to, a social worker is a coordinator and a community agent, change agent. As a social worker, we need to be a coordinator and a community change agent. Also an advocate and a manager. So that was all I have for the practicum, sir. Hello? Hello,
Yes,
sir.
yes. Can you hear me?
I'm hearing you, sir.
Okay, thank you very much for your presentation.
Sir, I'm here to complete, sir. To conclude, the challenges we faced there, because I went with my supervisors. So the road there, the rural areas, they are very bad, and the communication is very poor. Likewise, the people, the community, the community, most of them are not cooperating. And the reason they give was that government has been promising them and unable to fulfill. So those are the excuses they are giving us. So but we need to talk to them, advise them that they may not know the time the government will come to their aid. So they should be cooperating. And we thank God they later cooperate with us. So that is all I have during the practicum, sir.
Okay, the roads are very bad.
Yes, sir.
So I should tell the institute contractors to come and construct the roads.
It is the work of government to help the people in constructing the road and
It's okay.
to, yes, sir.
The aspect you went into, rural development and community affairs, is it not?
Yes, sir. Yes, sir. The community development department.
Community development. I like where you went to, because this is an area where many social workers don't want to go into. Because if you go into it, based on the kind of report that you write, you may not be in very good books of the government. It exposes you to a whole lot of monitoring and evaluation. And I am happy that you said you monitored some projects. But I have a fear in the monitoring you did, and I will explain. I'm not asking you to go back. In case of next time, if you have opportunity of monitoring projects, if it is a government project or a ministry project, what it means, I'm just giving you a guide. What it means
Yes,
is
sir.
that it must have been captured by the budget. It must be in the budget. If it is not budgeted for, it cannot be executed. So you need to know when the project was awarded, how much was awarded. There are some technicalities involved, so that when you are monitoring a particular project, you will know whether the project was executed to specification.
Yes, sir.
I have monitored a project where they are supposed to drill borehole. The overhead tank is there, everything, the tap is there, but the water is not rushing out. And we try to ask questions, what is the problem? They say they actually came to drill borehole, but when they were drilling, they did not get water. So on the day of commission, we went and brought tanker and filled the tank. Then the commissioner or whoever came, the tap, they cut the ribbon, everybody clapped. After 3 days, the water that was in the tank finished, and that was the end of the borehole. So you need to know.
Okay, sir.
You need to know some of this, so that when you are doing monitoring, your monitoring will be done according to specification. You know the budget line, the ministry, so these people we have worked with, they must have a budget line. These are some of the things that will help you to be able to do effective monitoring. It is a bit risky too. I'm not discouraging you, but it's part of the things we need to do to ensure good governance in our society. So this is area I feel I needed to talk about. You cannot work in rural development and community affairs. It is not a child's play, because it is directly on the life of the rural people. Do you understand? And for you to be able to make headway in that kind of environment, you need to equip yourself with the documents that are legal. I hope that is.
Yes, sir.
It's okay.
Thank you, sir.
Okay. Kehinde Foluke, Federal Medical Center, Abeokuta. Are you
here? Good afternoon, everyone.
Oh, yeah. Olowe. Yeah. Okay. Is that Kehinde? Yes.
Yes, sir. This is me, Kehinde Foluke, sir.
It's all right. You have the floor.
Thank you, sir. Good afternoon, everyone. I'm Kehinde Foluke. I had my practicum at Federal Medical Center, Abeokuta, Ogun State here. So I worked at the social welfare department, and a case I co-handled. I use the word co-handled because at a Federal Medical Center, no practicum student or SciWest student is allowed to handle a case single-handedly. So, but I was privileged to co-handle a case. So it was a case of, I was privileged to co-handle the case because it was, the period was when the hospital was having the promotional exam, promotional interviews for the workers. Unfortunately, many social welfare officers were due for promotion. So we were kind of short-staffed then. And because it's a tertiary health institution, there are so many departments, and each department must have social workers. So the social welfare officers, they were grouped like a clusters, and each group is assigned to each team. For instance, the mental health and behavioral medicine team, the stroke management team, community medicine team, HIV AIDS clinic team, so many, and even the wards, all the wards, cardio-renal ward, female surgical, male surgical. So social workers, all of them are, involved in all this department, in all this section, department and wards. So they are good. So as students there, we work. If you don't want to deceive yourself anyway, you know what you are there for. If you wait until you are asked to come and do anything, that's no. You have to, monitor each group. I want to work with you today. Follow this team. Follow. So that day, I was fortunate to follow an officer. It's supposed to be many, but it was only one that was on ground. Others have gone for their promotion interview. So it was a case of a 21-year-old female accounting student of a Lagos State University of Education, FA. This lady had two carryover. And so she now, attempted suicide. She drank a liquid insecticide. And the case later, degenerated into psychotic symptoms. She started behaving irrationally. She would be shouting, screaming, scratching her head. She was being paranoid, doing mental symptoms. So she was referred. And the caregiver was her mother. So there were two problems on ground. The case of the patient and the mother also now constituted another problem. The mother is an auxiliary nurse, all these trained nurses in private hospitals. And she was interfering with the medical management team. For instance, when they prescribed antibiotics, she was saying, no, she should not take this. She has taken too much and all those. So the team, they could not progress with assessment, diagnosis, and medical intervention for her. We had to come in. So myself and the supervising officer that I went with, so I was now asked, the supervising officer now asked me to undo the case because the team lead consultant insisted that she's not going to do anything except something is done. And so it was apparently the role of the social welfare department. So I calmed her down. That was my first experience, to get involved. You could only observe and ask questions. So I calmed the woman down. I now told her, I said, ma, let's just travel. Let's have a short travel in our mind. She was looking at me. I said, yeah, let's travel. Now remember all your investment on this lady since conception, pregnancy. And I said, now let's imagine the day of our convocation, our wedding, and all those stuff. By the time I started seeing all those stuff, I didn't even know where the inspiration came from. Maybe because I was emotionally involved. I don't know. So the woman just looked at me and started weeping. Meanwhile, I was making eye contact with my supervising welfare officer, and the woman was giving me a nod that go on. So the woman started weeping, and more so, BP had spiked up dangerously, according to one of the nurses on duty. They took her BP and they told us that she's not even, and she too confirmed it. So eventually, I used a system theory and a crisis intervention model was applied. Apparently, we provided supportive counseling. I let her know that the implication of a behavior. So she calmed down, and I didn't know, the idea just came because the lead team consultant said she was not moving an inch. So I excused and I spoke with my supervising officer that can we suggest that she writes an undertaking. She said, very good, let's go ahead. So we counseled her that she should sign an undertaking whereby she will state in it that she will not get involved with the management of our daughter's case. And while we were doing that, it occurred to me again. I suggested again that maybe she should do a voice record authorizing the team to go ahead. The consultant was happy, and she did as well. And there was another a family member on ground. So I suggested again that maybe she should just, excuse herself to go and take care of her health. While the family, by this time she was so vulnerable, she agreed, because I discovered that, from our training here, that you cannot do anything against their decisions. And I met that on ground in the hospital setup as well. So she agreed, and everything were able to restore order, and there was cooperation, so there could be progress that day. So, and I discovered that my role there as a social worker in that setup was multifaceted, in the sense that we are not only social worker, we are also mediator, we are even also counselor. So I saw myself there doing training as a counselor, a mediator, and
in there. Are you still there?
let me say crisis intervention. Major challenges I center, the workload was enormous, and the recommendation, is a government facility. Only recommend, though they thought the social workers are many, but they are not. They still need to employ more if government can employ more social workers, it will have positive effect on the emotional aspect of the social worker, because they will work lesser and they will be stable emotionally. And conclusively, I discovered that I was exposed to real life cases, real life cases that if care is not taken, one can even get emotionally down, that can affect one emotionally. And after some time, my confidence level was, impacted positively, and I was able to, I gathered skill in assessing and intervention and all the likes. Thank you.
Thank you for looking. Thank you for looking.
Welcome, sir.
The way you are doing your presentation, it is even emotionally draining. Is actual. Have you heard about PTSD? PTSD.
Yes, sir.
You know what it is?
Yes, sir. Post syndrome.
Post-traumatic stress disorder.
Disorder, yeah.
These are some of the things you see in the hospital setting. Things that can be emotionally derailing, that when you think about it, you begin to wonder who that is even providing intervention. Some people even begin to pity you. So you have done well with your intervention, trying to get the mother who is an auxiliary nurse to allow the medical team to provide treatment for the daughter. It is very necessary. Sometimes it is difficult for doctors to cure themselves. You understand? So for you to be able to get the mother to step away so that the medical team, that is a credit on your part. Along the line, you said that you discover that your roles are many. It is not only social work. You started mentioning counselor, mediator. All these things you mentioned, they are all part of social work roles. So you are still performing that duty of the social worker. Let me take you back, because your mental health is important to me. Why you also provide intervention? What do you think social workers can do in a hospital setting to protect themselves against what is either called burnout or PTSD?
Thank you, sir. Let me answer let me give the answer with the experience I had with the head of the department. The very first week I resumed, the woman had to call me at the end of the week and say, "Madam, sit down, please. She had to counsel me that, please, when you are coming from next week Monday, when you get to the gate of FMC, Federal Medical Center, put your emotion, keep your emotion at the gate, come with a lion's heart, separate yourself from the work so that it will not affect you. So it has to do with you. It starts with you, that she too has similar experience. So then when she told me that, I made up my mind, I started doing that. So that really helped me. So I think that is one major thing that one can do. One has to be intentional and consciously say, I'm not getting involved emotionally. That must be a limit. That was what I did practically.
So in addition, also make out time in fact, generally for everybody, make out time to go for recreation, make out time to appreciate nature, make out time to do workouts, make out time to do things that take your mind off. Sometimes the work you will do, it makes you refresh, it makes you get your mental health intact. So you can take a bow.
Thank you, sir.
Olade Yinda Abolaji Omotola.
Present, sir.
Mask care home for the elderly. Mask care home for the elderly. We'll have a lot of people working in old people's home these days. I don't know. Do you want to run away from Nigeria? You laughed. You did not. You laughed. You did not answer. In 5 minutes, tell us what you did in mass care home for the elderly.
Good afternoon, everyone. My name is Oladeyinde Abolaji Omotola. I did my practicum at mass care home for the elderly. When I joined the home, I was introduced to everyone, both the elders, the carers, the security guards, everybody in the home. And they also introduced me to all the activities in the home, including their cleaning, their feeding, their medical interventions, and so on. So for like 1 or 2 days, I watched them doing their activities so that I can learn how to do the activities too. So they taught me how they clean them, they taught me how they feed them, they taught me how they arrange their homes, their rooms, how they do many things for them. And I really learned a lot. So one of the skills I used crisis intervention and problem solving skills. At the home, we have elderly individuals with special needs. We have a woman that is visually impaired. We have those that are hearing impaired. We have those that had mobility issues, those that cannot move by themselves. So the one I was able to solve was the case of the woman that is visually impaired. One thing about her is if they give her bath soap to bathe, a big soap, instead of her to use it to bathe alone, she will use it to bathe and she will also use it to wash her clothes. She is visually impaired. So, and she's a person that she doesn't allow anybody to wash her clothes for her. She prefers to wash it by herself. And so when they give her soap the first day, by the 4th day, she has finished using the soap and she'll be requesting for more from her carer. So that day, the carer went to collect another soap for her, and they discovered that out of the whole pack, nothing was left. And so they were confused. They started they started arguing, and they were throwing such many things at the carer. They were like, maybe she's using the soap for her own personal use and so on. But she was sad. She was not happy at a point. So she started talking and she told them that the woman used to use her soap, her bath soap, to wash her clothes. And anytime she wanted to help her to wash her clothes, she would refuse. And even if she picked the clothes behind her, she used her own soap, normal laundry soap to wash it. If she give her the clothes, she will not wear it. She will not collect it. She will tell them, she will smell it and tell her that the clothes doesn't belong to her. So when they were just arguing, I took permission to speak. Then I told them that according to my own knowledge, I'm in special education. I told them that this woman is visually impaired. And for those that are visually impaired, they can only identify and recognize their things through smells, their odor, people, they recognize people by touching them. They recognize people with their voices and so on, and even places, the smell of a place, the smell of a house. So I now told them that she cannot collect any clothes from them if she did not wash the clothes by herself using her own soap that she recognizes the smell. And that's why she cannot collect the clothes from them. That the only thing they can use to help her to stop using her bath soap to wash the clothes is that they should provide a bath soap for her, and they should also provide a laundry soap for her. And they should tell her that, Mama, this soap is for laundry, and this soap is for bathing. And so she will stop it. So that day, because they shouted, they were just telling her, Mama, why will you be using this? They were just talking to her anyhow like that. And I was not happy that time. So immediately I counseled them that is how they should do it. They should just calm down with her, that is her own belief. That is how she can easily recognize her things. So they were all happy. And since that day till I left the place, there was no issue about the case again. So the knowledge I acquired there, I learned about their care services, how to develop strong personal relationship with the elderly residents. Then I also learned how to disclose, especially where there is bereaved, when they lost someone. At the home, they lost a woman. The woman was sick and they really took care of her. The doctors used to came, they took care of her, the nurses and everybody. They surrounded her with much of care. But it just got to a day that when I went to the home, anytime I get to the home, I used to greet all of them, like enter their rooms, apart from the male rooms, because females do take care of the females and males do take care of the males. So I used to greet every one of them, ask about their well-being and so on. So when I got to her room, I discovered that she was not on the bed. And I was like, what? So as even our roommate, the woman that they were staying together, she too was not there. They moved her from the room to another room. So I knew that something was wrong. So I went to ask a carer what happened. So she told me that they lost her. And what I learned there is they called me, they said, so when I asked them in front of another elder, like a resident, they told me that she traveled. Like she traveled, that her family, she was okay, and her family took her away. Okay. So it was later that they told me that they must not know anything about it. I must just tell them that she traveled so that they will not change their attitude, they will not change their reaction and reject every one of them because of the loss they had. So then my challenges there, adjustment to the work environment. Even before the adjustment, I was unable to get a place to do my practicum on time. I worked and worked in Lagos to find a place, but at the end of the day, I got that place. So I had the challenge of adjustment to the work environment. There are routines, you have to get there very early to take care of the elders there. Then at times, the elders do refuse to change their clothes, to bathe, even to eat. And at times, they do refuse to take their medication. I have a woman like that. She bears my daddy's surname, that is Olatunde, and his own name too is Olatunde. So when they were now talking to her, they said, Mr. Olatunde, come and take your drug. So I was like, I said, Mr. Daddy, your daughter is here. She was like, who is my daughter? I said, my name is Olatunde. I shall mention my name like that. So he said, so you came to visit me? I said, yes, Daddy. So no, I'm here for you. You just have to take your drug. And that was how we solved that issue, because he rejected everyone on there that he doesn't want to take his drug. But I used the name, is like, I am Olatunde. Daddy, you're Olatunde. You are my daddy. Your daddy, your daughter is here. So he was able to take his drug. Then another challenge there was aggression. Some of them are very, very aggressive, that they can they can throw things anyhow. So a case of a woman there, she was very, very aggressive. And those that sat beside her, she bites, like she wanted to just hold them very tight and bite them like that they ran away. So I was just at the door watching. So later I said they should just calm down. We started playing. I said, what does she like doing? So they said they like a song. So we started singing a song, play with her, tell us about your birthday, what will you like about your birthday? And so everything about her, the aggression left. I started playing normally. So another one is communication issue, because we have hearing impaired. We have those that are hearing impaired. They know, and some of them cannot sign. Assuming they have some that can sign, I would have signed. But we just have to be right, like moving closer to them, teaching them to use their hearing aids and so on. Then another one is mobility issue. We have the physically challenged that cannot move from one place to another, so we have to move them on their wheelchair. Then my recommendation, when I got to the place, I asked if they have any social worker, and I discovered that they are not having any social worker in the place. Then another one, so I'm recommending that they should get social workers in their home. Then they should train their carers, they should train everybody there on how to deal with those that they have special needs. When they train them, they'll be able to interact with them and relate with them according to their ability, so that they will not just get confused or get irritated with their behaviors. Then they should allow their family and loved ones to always pay them visits. Some of them get
In there,
yes, sir.
if I allow you now, you say this thing till thy kingdom come.
I'm
Ask
there,
you,
sir.
you had fun. It's showing in your voice. You had fun. I agree with you. Let's look at something a bit technical. Have you heard about elderly abuse in care institution for the elderly?
Yes, sir.
What, do you know what it is? If it is not, I'll explain.
What I know about it is when they refuse to help them, when they reject them, what they're supposed to give them, like their own needs, they refuse to cater for their needs.
So when there is the home for the elderly is supposed to be a safety net for the
Yes,
elderly
sir.
people. They are protected where they are safe. So
Yes,
it
sir.
is now an anomaly that abuse could take place in a place that is supposed to be a safety net for the elderly. That is elderly abuse in care
Yes, sir.
institution for them.
Yes, sir.
Now, some of these things are perpetrated by the caregivers.
Yes, sir.
As a social worker, what will you advocate to address this kind of problem? This center is where? Is it in Lagos or in Abuja?
Lagos, Abule Egba.
I'm surprised because I had Dr. Kemi when he was making the comment that most elderly homes in Lagos have a social worker. So
They are
it
not
is, I'm now surprised that one of your recommendations is that this ones will have social workers. So, but it's fine. It's fine. So just respond to what this issue I raised so that we make progress and take other people. Thank you.
Yes, sir. Part of my work there as a social worker is for them to really take care of the elders. When I discover that they are being neglected or they are not well understood, like they are not coming to their aid to help them to solve their problem. So I walk to the carers and I face them, that I call their attention to them, that they should help them, they should give them whatever they need. Like that, then they should come down and try to understand what they are trying to do, because they actually believe that their own is too much. Some of them like that. We have individual differences. They believe their own is too much. And I try to tell them as a social worker that no, their own is not too much, that they should come down to their level, that they can never ever go up to their own level, but they should come down to their level so that they'll be able to take good care of them, sir. So when I do this, they obeyed and they really perform what they're supposed to do. Hello, sir.
Okay, thank you very much. Thank you very much. You can take a bow.
Thank you, sir.
Okonkwo Christian Chinedu, are you here? National Hospital, Abuja.
Yes, sir. I am here, sir. Good afternoon, sir.
Yeah?
I am here, sir.
Okay, please. You have 5 minutes. Make it 5 minutes. Tell us what I've done in National Hospital.
Okay, sir. Okay, good afternoon, sir. Good afternoon, ma. Good afternoon, my colleagues. My name is Okonkwo Christian Chinedu, and I serve at the National Hospital, Abuja. And where I serve hospital is the social welfare unit. National Hospital is a federal tertiary medical institution that serves the general public. And their duties are to give medical attention. During the course of my service there, I was posted to they call it the unit, the social welfare unit, but is the department where I serve in the social welfare unit. They call it special treatment center. And this center is basically taking care of those who are HIV positive, who come for HIV treatment, counseling, and the like. So in the course of my service there, for the period I served there, I helped in counseling and my documentation. But before then, for the period I went in there to do the service, I was introduced to I was introduced to the department by my HOD. She introduced me to the department and showed me various offices and their assignment designations and what they do for the Office of the Social Welfare. And like as I said, where I serve is the where they posted me is the special treatment center where they handle cases of those who have HIV issues, who come for counseling, who come for drug advice, who come for medications and all the rest. And one case I handled, although we handled several cases, but one case I handled that of interest to me is a young lady between the age of 28 to 30 years. From my interview, to her, she said she's a hairdresser, and she's HIV positive. And in HIV case, we have different levels. There are different levels to HIV cases. Now, I quickly find out that this lady in question, over the period of time, because she has been coming for counseling and medication and all that, but for a period of time, she stopped coming. And the person that I was attached to work with her, as she was looking through the records, she found out that this lady has not been coming for counseling and medication, and possibly because there is this, they check their viral loads from time to time, and then also give on what to eat and what not to eat. So the person I was attached to work with now quickly realized, in the course of her checking the system and the records, find out that this lady has not been coming for her medications and counseling and all that. So we called her. The next day when I came, she now, because it was a particular case for me, because I told her, let me take up this case so that it will be my reference point when things like this come. I didn't know that this would come up. So I now took that interest. I think a day or two after, the lady came, and when I was working with that madam, she now told me that this is the lady that we called on to come for us to check her and all that. So when she came, we collected her records, got her records, and we found out that when she was supposed to have come for her treatment and and all that, she has not been coming. So it took my attention. I now asked her, young lady, what is your problem? What has happened? She now said that her sisters they have not been giving her attention, that they have not been helping her, because this thing has really now eaten her up somehow, that you will even notice that she is HIV positive. So I now asked her, what is making you, because she now became hysterical, she now became, restless, I now asked her, what is your problem? She now reeled out all her problems, issues of stigmatization, isolation, and nobody's giving her attention and all that, because she has been sick and all that. So I now asked her, do you have a family member? She said, yes, she has a family member. But good thing, she came with the family member to the hospital that day. So I now appeal to that her sister to please as a matter of fact, make sure you're always with her. Make sure you always bring her to the hospital for her checking her viral load, making sure she takes her drugs regularly, and making sure she comes for clinical examinations from time to time. That lady agreed with me. And what that has helped me to do is that I think with psychosocial behavioral theory, I was able to, identify those issues, those challenges, with her, and then we were able to, tackle all that with her. And she, even as at the time I left there, late August, she began to stabilize. Was even when she saw me, she was like, "Brother, thank you, because the way you spoke to me, the way you talked to me, I felt very bad before." And now told her that HIV is not a death sentence. In fact, I spoke with her, and then she quickly, over time, she started recuperating. And when I saw her last, I was happy, with that. So that was a case I handled, and that theory helped me. That theory of psychosocial behavioral theory, it helped me to handle that case, and we're able to get her out of that situation. Now, my role as a social worker, social workers is a helping profession. I quickly find out that in that department, the department handles a lot of cases that concern social welfare. And my role, our role as a social worker there is to intervene in those areas, where necessary, and give counsels, so that people can be able to, overcome the challenges they are going through at a particular point in time. So I think that role I played there, gave me joy, because I was able to, talk into the psyche of so many people, and they were able to, see sense to what I said, and then a lot of them, began to, like those that are having HIV, began to see the need for them to take their drugs regularly, because some of them were skipping their drugs. They were not taking their drugs when necessary. And they are also, like as my colleagues, senior, the staff there told me, there were certain things they are not supposed to take, which when she asked so many of them said they have taken doses. She now said, no, don't take this. If you're taking your drugs daily, don't take this, because if you take this, it will inhibit or reduce the efficacy of the addiction. So I think that, as a worker, it helps you to, to know what to say or what to do as a social worker at that point. Hello, sir.
Conclude.
Okay, sir. And the model we used was the model of, as a case for a case management, we used the model of assessment, evaluation, making treatment plans, following up, and then the discharge and all that for so many of the clients. Now, some of the challenges we face there is the influx of cases. I clearly understand that because of the socio-economic situation of the country, so many people are having challenges of poverty and lack. So as a result, those are the challenges we are facing there, because the influx of people were that many for us to manage. Then two, the drug dispensation, we are also like told them that this drug dispensation unit, like there should be a specialized location for those who are, because sometimes some people who have some stigma or whatever to go to where they will get drugs in the public drug dispensation unit. But and I told them, say, if they have a special place where HIV patients can go to have their special drug, because some people can go and hide and say, okay, I don't want somebody to see me that I'm going to take a drug, HIV drug. They can go to that particular place to take their drug. And then I also looked at the challenge of they needed more social workers to be in that department to help them to manage that case, those cases. Then another challenge I saw there is that the facility needs to be expanded. Those are the challenges I see there. Then the recommendations I made when I left was, one, that drug and drug dispensation unit should be made more affordable, like as I said before in the challenges. It should be made more affordable and easy for people who are HIV positive to access those drugs. And government should as well subsidize as quickly as possible and as much as possible through the National Action Committee on AIDS and all that to make sure that those who are HIV positive should access their drugs as much as possible and easy and affordable. Then more and more another recommendation I made was that more and more social workers should be trained. So I'll be deployed, especially to a place like this where we have influx of patients and clients, to manage these situations. And then the facility should also be expanded. That's a social welfare, because the small unit should be expanded and more hands to be brought in so that there will be more client management. So for the period that I stayed there, sir, it gave me a good exposure for me to know that there are cases like this that people, are going through, especially HIV cases and HIV issues. It's a big case and a big trouble in the country. And it gave me a big exposure, and then I opened my eyes to also, contribute, in making sure that, these services are given to these clients that are concerned. That is my submission.
Okay, thank you.
Yes,
Who is Stella? Take a bow.
Not be my place to come collect food. So why they asking that question?
Christian.
Please, sir, we can't hear you again.
Christian,
Okay.
Can you hear me?
Yeah, I'm here, sir. Yes.
Okay, I say you can mute your mic. I'm done with you.
Oh, okay, sir. All right. Thank you very much, sir.
Leke Oyedemi Emmanuel. Are you there?
Yes, sir. Yes, sir. Good afternoon, sir. Good afternoon, ma. Good afternoon, my colleagues. My name is Leke Oyedemi Emmanuel Oluwafemi. I carried out my practicum with Lagos State Government, Ministry of Youth and Social Development, Old People's Home, precisely, located at 1 Lancaster Avenue, Sabo, Yaba, Lagos. I applied system theory. During my practicum. And one of the cases that I had so much interest on was on a particular day when I was doing my monitoring around the aged people. I discovered one of the aged people was not very happy. He was almost under depression that I had to take time to sit with him and listen to him and counsel him. And he told me confidentially that he had long ago seen his son to visit him, and he doesn't know the reason why he had not visited. I approached my supervisor, who gave me the go-ahead to go for his file and search his contacts and the contact of his children and relatives, which I did, and I got back to him and to her. My findings there was that all the phone contact we had from that file, the phones were unreachable, except one particular one who was the man's siblings. And I tried all I could with my supervisor's approval to visit the person, who led me again to one of the aged person children. That one was very, very, very sick as at that time, and he directed me again to somebody else who gave me a link to his son. His son, precisely at the time I saw him, he was not happy too. He was very, very, very down economically. He claimed that economic hardship could not allow him to come and see the father. And after much counsel with him and encouragement, he came on a particular day to visit the man, and the man was much happier, and he understood the ground of the child. And we also counseled the child that whatever be, he should give us understanding. He should give us information on whatever could happen, so that we'll be able to talk to Baba, not to go under depression again. I had a challenge during that period, which was documentation, especially on visitation or visitors. There was no proper documentations from visitors, especially those who are visiting the people who are aged people in the home. So due to that, my intervention, that correction was made, and there was a lot of improvement thereafter. Another thing was the social worker available in the home were not enough. There was much aged people in the home than the social worker can handle. It was as good as 28 aged people with 3 social workers. But there are adequate caregivers in the home. That was very, very, very encouraging. My recommendation there goes that the aged people were always complaining of trying to move out. They want a situation where they will be having a recreation outside or going for a stroll. In the particular environment where they are, there's no gathering, and it's as good as the place is shocking to them. All they had there was just a recreation hall with indoor games. So it's most of the time become boring to them. So I'm recommending that there should be an extension of old people's home, probably around 5 other divisions of Lagos State, so that there will be more room there to develop, and these people can have their own time to have nature, the breath of nature around them. That is what I have to say, sir. Thank you very much.
Like Oyedemi.
Yes, sir.
Old people.
Yes, sir.
Yeah, it seems the challenges you have seems to be similar with all those whom you have from old people's home.
Yes, sir.
Were you able to witness any kind of abuse in that home?
Yes, sir. I witnessed one which I observed, and I called the attention of my supervisor, and it was corrected immediately from the caregivers.
From the caregivers?
Yes.
The home, does it have a social workers?
Yes, it has social workers, but they are not adequate at all.
I'm not like how many, so that we don't. You know, there
3
is a
social
difference
workers.
between. There is a
Yes,
difference
there are
between
3 social workers in the home.
You said 2 social workers?
3, sir. 3, sir. 3. 1, 2, 3.
Social
3.
work.
Yes, social workers. Yes, sir.
If you have 3 social workers in old people's home, I think that way there is a difference between the caregiver, those who provide care, social workers. Sometimes you begin to hear some of the things. We change diapers, we change those things are not.
Yes, they are caregivers' work. Those are caregivers' work. Noise coming. I can't hear you again, sir. There's a noise coming from somewhere.
Okay. Now, are we still here?
Yes, sir. I'm here, sir.
Okay, so I think you've had some comment we made concerning those who did their practicum in old people's home. Were you here when they were presenting?
Yes, sir. I was.
Okay, so there is no problem now. Well, I think we'll take up from there. We'll take it up from there. So you can take a bow.
Thank you very much, sir. Most grateful.
Yeah. Adelo Wolayemi Deborah.
Good afternoon, sir.
You're welcome.
Thank you, sir. Good afternoon, man. Good afternoon, my colleagues. I also did my practicum at Old People's Home, Sabuyaba. And it was a very good experience where the matron introduced us to. Sir?
Can you hear me? Can you hear me?
Yes, I can hear you, sir.
Meaning you did the same, you were in the same place with Emmanuel.
Yes, sir. Yes, sir.
Give us a different scenario of a case you treated. You can do that in less than
Okay.
3 minutes.
Okay, sir. Thank you, sir. Actually, during my work there was a man that is over 60 and he lost his wife like 6 years ago, and not knowing he was still grieving for that. He came to the home less than 2 years after his last child that was staying with him got married. So one day when he saw me, he just called me. I think I mentioned that when you called us for the interview, for the inspection too. He now said, the way he's looking at me, that can he marry me? That is, since he lost his wife, his life has not been the same. So that was when we took him up stylishly, talking to him, because he doesn't talk to anyone. He's just always on his own, looking at everybody as if he can't talk. And he was already having partial stroke. So, but before I left that place, after talking to him, encouraging him, and bringing him out of the grief, he was relating with others. He joins them in the common room, and small games, he started trying to participate. Before, when they have visitors, he won't join them to even welcome them. But later, he started singing with others, relating. Even when I come, I'll be looking for him, only to discover that he's already in the common room. Like before, he will sit outside his room alone, and from morning till evening, he will not talk to anyone. So that's the main case I think I want to mention. And some of the problems I encountered was attitude of some caregivers. It was observed that some caregivers get fed up of the task due to the attitude of overbearing attitude of the old elders. The presence of a social worker makes them uncomfortable to react to them harshly. And another challenge is excessive behavior of the older persons too. They don't want to know that they are getting older. They still want to behave like they used to, regardless of their age and their health condition. So we have to talk to them over time before they can realize this. And my recommendation, sir, with the little experience I have, I think the government should provide more of these facilities in several areas, like the 4 other divisional areas of Lagos State. And there should be regular training for the caregivers for optimum service delivery. Also, in that place, there is need for physical activities, more of it, that will encourage the elders to feel happy with the environment. And government should provide subsidy in form of probably tax reduction for private old people's home, so that we can have more of it in our society and bring the good out of the elders. That's my recommendation and my submission, sir.
Can you hear me?
Yes, sir, I can hear now.
Okay, I'm curious. I'm curious because why will the caregivers behave in a rash way when they see social workers?
No, they might want to talk harshly to the whole elderly ones instead of talking to them in a manner they will understand, because sometimes they ask for too much and the caregivers will be like, mama, I'm coming, and they can go for a long time and not come to them until when they see that the mama will not have any other choice than to dance to their tune.
instead of talking to them kindly, because sometimes it might be tiring too. Probably they are burning out. I really don't know what to say.
Okay, taking care of the elderly requires special training and special care.
Yes,
So
sir.
school of thought that as adults, as people get older, they tend to begin to behave like children. They begin to seek for attention. It is natural. And one of the worst things that will happen to an elderly person is when you did not take their complaints seriously.
Yes.
Or you dismiss anything that is, for example, elderly person is telling you, my leg is paining me, I'm having headache. You just simply dismiss the person to say, don't worry, it is old age. You know, all these things are some of the things that makes the elderly to feel as if their concerns are not being taken care of. So it requires special training, especially if the workload is too much for the caregivers. You cannot see how the workload can be balanced. We are all human beings, even as a social worker. If you have excess workload, it has a way of affecting your productivity. So because you are a caregiver does not mean that if you have excess workload, it's not going to affect you. So these things are holistic things that needed to be done. The caregivers needed training. The old people also need to be talked to be able to appreciate those who are providing interventional services to them. That is the only way you should be able to mediate between the caregivers and the elderly person in home and see how they can form a synergy and make the work easier for both the caregivers for the elderly person in those homes. It's okay.
Thank you, sir.
Cinderella.
Yeah, good afternoon, sir. Good afternoon, Deputy Registrar. Good afternoon, everyone. Hello, sir. Hello. Hello, sir.
Can you hear me?
Yes, I can hear you, sir.
I feel like disturbing this class like other person. I feel like
You said what?
You have been disturbing this class.
That I'm what? I didn't hear. What did you say?
You have practice to present your presentation. Can you?
Okay.
If you cannot hear me, go to a place where you have network. I hope every other person can hear me.
Okay, do you know what, sir? Please, I'm on my way to Warri right now. At least give me like, I'll let me chat you up when I'm already there because I'm on the road, please. The network is breaking. Please.
Watching us, Emanuela. Are you here?
There's no network on the part I am right now. I'm in a village. So I'm going back to
Let's see and do your practice. Your mic.
Yes, yes.
Hello, sir. Hello. Hello, good afternoon, sir.
I've gone past you.
Yes, let me present when I highlight, please, sir. Please.
What is the meaning of this nonsense now?
Hello, sir. Good afternoon, sir. This is Emanuela China, sir.
Go ahead.
Good afternoon, sir. Good afternoon, ma. Good afternoon, my colleagues. My name is Okonkwo China, sir, Emanuela. I did my practicum at the Graceful Daughters of Dorcas Foundation. It's in Ketu, Lagos State. It's a faith-inspired non-for-profit and community-focused organization. The foundation is committed to empowering women, supporting children's education, and assisting vulnerable individuals and communities through... Ma? Hello? Through empowerment programs, education supports, and charitable outreach, like giving food items and the rest. The unit I was placed in 4 different units, which is the community outreach, where there are some health programs we do, where we talk to the community, we speak to them about some like cervical cancer, let them know about it, HIV and the rest. Then we have the women empowerment program, whereby soft loan is given to these women. They don't pay interest. They will take them through entrepreneurship training. Then we'll also follow them up by visiting them in their shops to see how they are doing in their businesses and see how we can give them 1 or 2 suggestions to help in improving their businesses. Then we have the education assistant outreach, whereby children that are not in school, that are doing very well, but their parents are not able to meet up with the school needs. Sometimes widows, sometimes but some bad things could just happen in the family, and there's no means for the children to continue going to school. So that's where we come in. We come in to help the child further to tertiary level, and we don't just stop at paying the children's school fees. We also try to engage with the child in case the child is lacking in any area. Sometimes what I noticed during my practicum there is there was a particular family. The son was not doing well in sciences. So we later found that after getting involved with the parents, we later found out that the parents wanted him to be a doctor, and that was not his interest. He wants to be an architect, and they're forcing him to be a doctor. So he was not so doing well. So we had to engage the principal. That's the principal of the school and the parents. We had a meeting. We had to explain to the parent that, see, it's not all about being a doctor. There are other courses the child can do, and we still make it big in life. So the parents now accepted. So the child switched to art class, and the child was doing like for the past 2 terms, the child's result has been excellent, and we were really happy about it. The last part that I learned, and I was really happy that I learned so much, was on the monitoring and documentation, because there's a way they do their documentation that it was really exciting, because I was able to learn how to write a monthly report about women. It's not just about writing that they are progressing. I think there are some me that don't really like maths, but I saw the calculations and I was able to understand it, calculating how the women progress, how they make their profits, how they are able to contribute. Sometimes it's not all about giving them loan and you just leave them like that. So with this method and everything, I was able to learn that at times some of them carry 80% of the family responsibility. So they were not able to meet up with the capitals, and some of them collecting loan, they forget that they need to differentiate between family and business. So those were the things I was able to learn, and I was also able to teach some of the few women that I met, especially some of them that couldn't communicate very well in English. At least I was able to communicate in the local dialect, which is for the Igbo aspects, which I'm good with. So there was a case I was able to identify, which I said earlier about a child. I spoke
Help me
about
reach junction, I beg.
Hello? Hello? So I was also able to speak with the child's mom. She was not really doing anything. So we're able to engage with her, ask her what she could do. So she told us the kind of business she was doing before. And she was like, she would like to start all over again. And we're able to start that for her. So I was able to also meet with the department that was in charge of giving out the disbursing the loan to them. It takes about 3 to 4 months because they have to go through trainings. So after the trainings, I had to beg them to see if they can give her own funds immediately, because they were barely feeding. and the food stuff they were being given, it's not enough to feed a family of 6. But currently now, at least she's making sales, because what she does now is she does bole and yam in one garage in Ikorodu. So at least she's making sales, and what she pays daily, it's a little to nothing compared to what other shops pay. For the theory, model, and then perspective applied, what I was able to learn was the empowerment theory. So in the empowerment theory, I was able to understand the needs assessment, because through this woman, I was able to identify what she needs. And what she needed was, she needed an empowerment and she needed support for her children. I was able to encourage her especially during the training sessions, that's the empowerment training sessions for the women. After the training, I'm always sitting down with her, trying to explain things that they taught that day, because at times she's like, she does not understand the big English they are speaking. So I'll sit down with her and put her through and explain it to her, the bookkeeping and every other thing she needs to know to understand about the entrepreneurship aspect that was taught. And I was also able to be a support to her, in the sense that I'm always calling to check up on her, to know how she's doing, to know how her children are doing, and every other thing concerning her, just to show my support to her. So what I was able to learn as a social worker during my practicum was, I was able to participate in advocacy visits and sensitization exercises, in the sense that I've not really been into the community outreach very deep, especially when it comes to the health sector. But here I was able to advocate, I was able to meet some people, and I was even privileged to be able to speak to some ballers and the rest regarding some issues we were discussing about in the foundation. I was able to learn about documentations, collecting data, preparing reports, other methods, other different methods. I was also able to learn about, because I understood what empathy means, but I've not really been on the field. But with this, I was able to fully understand, and to fully put it into practice. About
Manuela, 30 seconds. Conclude.
Hello, sir.
30 seconds.
Oh, okay, sir. So my recommendations, I recommended to them that they need to provide more training for volunteers and their staffs. Also, improve collaboration with community leaders to speak more, because some of them during the health thing, we're not able to do much, because some of them were scared to come out because of the way they were dressed and all that. So they were feeling reluctant to expose their body and all that. So we speaking to the community leader should be able to speak to them. It will make it easier for them to come out for the health talks and also the tests that were run. So those are the things I was able to learn. Thank you, sir.
Thank you, Shinasa, for your presentation. The Graceful Daughters of Dorcas Foundation.
Yes,
Is it
sir.
empowerment for children or for youth or for vulnerable household?
It's for all. It's for both youth, women, the community, and all. It's for, let me just say the community, because community has both sexes.
Do they have eligibility criteria?
Sir?
Eligibility criteria.
I don't understand your question, sir.
What is their eligibility criteria? How will you be eligible to get intervention or services from them?
Okay, you write you send them a mail, or you call them, and they respond to you immediately.
We are serious. And we are still having the number of poverty. And are you aware of the report released by UNICEF like less than 48 hours ago? Have you seen that report?
No, I have not, sir.
That 2 in every 3 children suffer multidimensional poverty. And we are having this one that once you write to them, they respond immediately. So I'm just wondering, but it's fine. You have some experience. From what you have presented, I find it difficult actually to narrow the intervention to a specific area. You cannot be jack of all trades in a situation of this nature. You either focus on vulnerable household, or either focus on youth, or either focus on children, or either focus on women. So when you have a foundation that is all encompassing this nation, it doesn't give a clear direction. So that is one of the things you need to do if you are working with them, so that you have a direction. If you have fun to do all of them, fine. But the way I saw you juggling through different aspects, you even went as far as doing counseling for somebody who is interested in a particular field and the parents are interested, so it gave a whole lot of mix-up of intervention. So I'm thinking that they really need to narrow down, and if you have link with them, these are one of the things you will help them to look into, so that they don't become jack of all trades and become master of none. I hope my comment is clear.
Yes, sir. I've noted it down now.
It's all right. Nsima ini ibanga. Are you here?
Good afternoon, sir. Good afternoon, everyone.
Yeah.
My name is Nsima Inibanga. I am a.
Sorry, you know what?
Sorry, sir.
Ibanga.
Sir, is Ibanga? Okay, yes, he's my brother.
Oh, he's your brother.
Yeah.
All of you are doing social work. That's fine.
Okay,
it's my
sir.
friend. Go ahead.
Okay, sir. I did my practicum in Okobo Local Government Council in Akwa Ibom State under the Department of Social Development, Education, Information, Sports, and Culture, specifically Education Units. The department caters for diverse categories of people, like including the children, youth, adults, the elderly, the persons living with disabilities. The service focuses on literacy. They do empowerment, they create awareness, and community development. So I want to talk on a critical incident, a storm that destroyed the roof of a classroom block that was used by adult education at a primary school in Amamo. This storm ripped off the roof of the school, exposing the interior to rain and making it unsafe for use. This sudden loss of learning space disrupted the adult education classes and created safety and emotional concern for learners, especially the ones that were undergoing vocational training. So in adult education, you like beg some of the learners to come to school. So when things like that happen, they will stay back. They say, how can I waste my time? It's like people are not serious. So we had to put a letter to the chairman through the supervisor. We followed up. We went to the chiefs. One of the village head is actually a student. He's in, I think, primary 3. So, with politicians, we don't get prompt response, but they saw the pressure was really much on them because the students were willing, they wanted to go back to classes. So I think it was in 2 weeks, the chairman was able to respond and the roofs were fixed and renovation was done. For theoretical framework, our response was grounded in an empowerment and strength-based perspectives. My role included assessing needs, coordinating stakeholders, and providing support. I also promote adult education by creating awareness. Some of those people that does not see need of going back to school, those school dropouts, we normally go into the markets. We go to markets to create awareness. We go house to house. We go on supervision. We check on students that are not coming to school, the ones that have not come to school for like 2 to 3 times. We go to their houses. We get to know why they are not in school. We do need identify their needs, and we link people to resources, helping adults gain skills from empowerment and community development. Skills. The skills I learned several skills, including need assessments, report writing, community mobilization, effective communication, and most especially teamwork. I also gained potential skill in documentation, field observation, and coordinating social intervention. Some of the challenges we face were limited resources. The council had constrained funds, completing immediate repairs, bureaucracy, community awareness. There was no formal disaster response plans at the local level. So many residents were unsure how they will be held. So to address this, I recommend engagement of community members, adult education, and local leaders in disasters planning and response, establishing of local emergency committees, and empowerment of social workers. Research shows that empowering social workers to lead in recovery improve the outcome. We can ensure social workers have authority and resources in emergencies, can strengthen the response. In my conclusion, the experience enlightened the importance of social work in building community resilience by applying empowerment, strength-based principles. We turn a crisis into opportunity for collective actions. Thank you, sir.
Thank you, Sima, for the presentation. Were we able to take any challenge, please?
Sorry, sir.
Any challenge?
Challenge, yes, I said my challenge. I said limited resources. We had community, yes, limited resources. Like in classrooms now, some of the classrooms we don't have seats. So some of these students, they complain of writing material. Basically, the departments on our own, we contribute money. We buy, when the NGOs, I learned the NGOs used to bring books. So when the materials are not there, like when I was there, we contributed money, buy books, and send to them. Because if you don't give them writing material, they will tell you they don't have money to buy books. They don't have money to buy anything. So if it is not much, we just sacrifice, we buy books and share to them. 40 leaves, we share to them for them to be able to come to school.
You are engaging in a very bad social work practice.
No, sir, I'm not the one doing it. That's what I went there to see. Like when I went there, the director said the book the NGO brought had finished.
I hope there is hot afternoon in your location. There is hot afternoon in my location. You follow them to contribute money, even if not once.
So I had to leave because everybody contributed.
Wait, you follow them to contribute money now, is it not?
Yes, sir.
See, one of my responsibility is to tell you when you engage in a very bad social work practice. In Akwa Ibom State, do they float free education?
Yes, they do free education, but not to these adult education. It does not cover them.
Okay, not for adult education.
Yes, sir.
The local government is the people floating the adult education.
Sorry, sir.
Is it the local government are the people floating the adult education?
Yes, sir. Yes, sir. It's handled by the council.
Now, everything government is to put me anywhere. Anything government is doing, they have a budget line for it. Do you know the budget line for that adult education? You don't know. You did not ask question. There is nothing government is doing that they don't have a budget line for. So when you work in that kind of environment, know the kind of question you are going to ask. It may be lying fallow somewhere. We may be surprised if it is going on. All the government in the state, the implication is that there is a budget line for it in the state budget. Government can be useless for any kind of thing we can accuse government of, but government cannot follow a program without having a budget line for it. So you people should go and get those who are responsible for that. You cannot, as a social worker, be engaging in out of pocket and quarrel who are in medical social work, those who are in hospital, who take their salary to be able to pay clients anywhere. Put me anywhere you have that kind of practice. That is a very bad social work practice. People take their salary in order to do social work. So you need to contribute money, the social worker. That is, you have not gone there and contribute. Anywhere you go to get contribute money, you're not going to do social work. You're going to philanthropy. I hope the point is clear.
Thank you, sir. Yes.
It's all right. You can think about.
Thank you, sir.
You're welcome. Yeah. That is our number 15. You are back. Oluwatoyin Ademi, are you here? We passed you before. So I'm trying to know if you are back. Oluwatoyin. Okay. If Oluwatoyin is not here, we'll take on the next person. Let me 1 minute. Let me make sure that okay, yes. I didn't mute myself. Ojo Oladoyin Ayola. Are you here?
Yes,
Ojo.
sir. Yes, sir.
Okay. Human Development Initiative Foundation. Where is that?
It's Iwaya, Yaba area, Lagos State.
You have 5 minutes to tell us what you have done in Human Development Initiative.
Yeah, thank you very much, sir. Good afternoon, sir. Good afternoon, my colleagues. My name is Ojo Oladoyin Ayola, and my practicum experience was done at Human Developmental Initiative Foundation, Iwaya, Yaba, Lagos. The primary assignment of the agency is to build total human development by gathering and sharing information on human rights and equality policies for all the society. The services include child care, protection, empowerment for widows, youth empowerment, healthcare intervention for the less privileged communities, sensitization to prevent sexual abuse, child labor, irregular immigration, and human trafficking. And I met a 14-year-old boy, he's in primary 4, And normally it is a practice in the company that every child under the educational trust fund, the beneficiaries, they always send a representative to their school once in a session. So I was assigned to check on this boy at his school. So I called his dad for the description of the school. So fortunately, his dad also came to the school to meet me. So when I got to his class, I asked about his academic performance, checked him emotionally and every other well-being. And I noticed that he had a deep wound on his right leg. It was smelling. I first spoke to the teacher that what's really happened, and she said it has been there ever since. So I had to call his dad and ask him that what happened, that how come this leg has not been treated or what. He said they have tried everything, that it has been there since he has been 2 years old and he's 14 now. So that's like 12 years ago. So I went back to the office. I wrote a report and told them about if they can they can approve an intervention, and which they did. So the next week, the following week, I took him to General Hospital. Luckily enough, I stay not too far from where they stay, so it was very easy for me to manage the case. So I took him to the hospital for series of tests. They did an X-ray, they checked his blood sugar and every other thing and all that. And what they noticed was that he had osmolysis, that's infection of the bone. So that was what caused the wound from not healing all this while. And they also said he's malnourished, that he has not been eating well. So he was given a particular supplement, and we kept going almost every week, every 3 times in a week. I follow them to the hospital. We meet at the general hospital for cleaning. And the company, the agency, gave out money to buy different things and all that. So, but the challenge I actually encountered there is that most of the time when I visit the hospital with them, I find myself using my own personal money to buy most of the things they need in the hospital. Then the company will reimburse me, but most times, because it's a company, before they approve the funds and all that, it might take time for me. I might need my money on time. That's one. Then two, sometimes I get to the hospital before the father and the son, and sometimes they even miss the appointment because maybe no transportation before they got money to come, just some kind of financial incapability and all that. So I just want to recommend that the company should try much as possible to empower the beneficiaries' parents so that they can also stand on their own and support their children's basic needs. And the theory that I applied, recognizing the importance of collaborating with the family, the school, and the health caregivers to address his medical and educational needs, reflects the system theory. Then also I applied the strength-based perspective that focused on the family's resilience and capacity to cope despite facing challenges. Also, the boy's own strengths, adapting to visual impairment, nursing a deep wound, and progressing in school shows the strengths perspective. So, and I also applied the crisis intervention. The crisis intervention is typically involves assessment, planning, intervention, and resolution. So that's it. Thank you, sir.
Thank you very much, Ayola,
Yes, sir.
for that presentation. My worry again is that the organization you work seems to do a whole lot of things, combining different things at the same time. I don't know whether it is a strategy so that if there is a grant from anywhere, they will tell you we are running the program. But it's fine. And the case you have actually handled, the person with the... So before you left, what is the progress the person has made in terms of recovering from the injury?
Yes, as at when I...
Hello?
Hello, sir.
I can hear you. Go
Yes,
ahead.
sir. As at when I transferred to the human resource department, the wound was plain. As at that time, the two parts of the wound that is yet closed, they need to take it for a test to know what exactly is wrong apart from the bone. So that was the last I got from them.
It's okay.
Yes, sir.
Oluronke Yetunde Ogidiola, are you here? Special Correctional Center for Boys.
Yes, sir. Good afternoon, sir.
Good afternoon. Go ahead.
Good afternoon, sir. Good afternoon, ma. And good afternoon, everyone. My name is Ogidiola Yetunde. My field practicum experience ago, specifically the correction. During the one of this and me, like to there is a case of involving the and the theory I is family system theory because it helped me to understand the genetic through the interview was able to identify the areas. But the boy was operating in the area. And this exposure emanated from, when in which maybe they send him an errand, go and be prepared at the transaction. So, as my work as a social worker, right, with observation and this involved interviewing the boy, information on his environment.
Oluronke, I can barely hear you. I don't know whether it is from your end or from my end. I can barely hear you.
I hear you clearly.
Eh?
I can hear you clearly.
All right. Yeah, go ahead. Now you are breaking along the line, making your presentation incoherent.
Okay, I can hear you clearly.
Go ahead.
Okay, so as a coach worker at the correctional center, on my observation and resolution on the boy. So this involved interviewing. I interviewed the boy to gather comprehensive information on his family's background, environment, and precisely the origin of the problem. So this helped me to develop, a plan or a resolution. So, and again, a key aspect of the plan is to ensure that that the boy is reformed, and also when he's ready for reintegration into the society. We do advise their mother also, maybe they should change their environment. So I also utilize a strength-based approach, focusing on the boy capacity and potentials for positive change, rather than dwelling solely on his weakness. And I see that this boy is very brilliant and a fashion designer. He even made clothes for me to wear. And when I wore it to the center, I was very, very, very happy, to see. He even told me that he would like to become an international fashion designer. And through this, I started, I counsel him every time I do counseling. If I still go there till anytime he sees me, he's always very happy around me. Even I introduce some other practicum student over there to him. Maybe they should, be giving him clothes, to help them sew because they have a vocational center there. So, and again, in my conclusion, my field practicum experience has been an invaluable experience because it has enabled my knowledge and skill and the opportunity for one-on-one interaction with the world has deepened my understanding of their unique needs and perspectives. Specifically, it has sharpened my ability in active listening, patience, and building rapport. So my recommendation will go this. With the growing number of juvenile crimes, which is becoming alarming, I think there is need to build more of these centers across the state. Thank you, sir. That is all. Hello.
Ogidiolu. Ogidiolu. Oluronke, can you hear me?
Hello.
Can you hear me?
I can hear you clearly.
Okay, you did your practicum in Lagos State. Am I correct?
Yes, sir.
And you want them to build more of such facilities across the state?
Because the rate of these juvenile crimes is becoming alarming so much, and the capacity there, the own capacity there, I don't is not in where I did my
Okay, let me ask you. What do you think breeding all this delinquent behavior?
Huh?
What do you think is breeding all this delinquent behavior?
Okay, what is to me? One of these I would say is family factors, maybe some parental supervision.
Yeah, so we're not going to build correctional facilities all over Lagos so that once your child misbehave, you put it in that place. I'm looking at the viability of your recommendation. Do you understand what I'm saying? The problem is big. The problem is huge. So building so who are going to work in all those correctional facilities? We can, if it is from the family, or family upbringing, or as a result of government not meeting their yes, as a result of government make the corruption and the bad governance and the rest, then your recommendation should be tailored to those areas to hit it at the root. If you like, go and build 100, what they call it. If you like, go and build 100 correctional facilities, it's not going to do anything. It is good we have some of those correctional facilities to take care of those, that we feel that are risky to the society. But the problem is huge. It requires serious family orientation. It requires a kind of a state actors attitudinal change. So you should be able to look at your recommendation from those aspects, those things that can prevent it, those things that can eradicate it at the root, not a palliative. Any child that misbehave, how many correctional facilities are you going to? If the way continues the way they are, we'll continue to have more delinquent children, except we change the things that we needed to change. Anyway, that is my concern. You can take a bow. Umar and Jejo Joseph. Yeah, Umar and Jejo Joseph, are you here?
Good afternoon, sir.
Umoren, I hope I pronounced that correctly.
No, sorry, good afternoon, sir.
Yeah, General Hospital, Mina, go ahead.
Sorry,
Good
this
afternoon,
is
sir. This is Umarin J. Stella, sir.
Umoren.
Good afternoon, sir.
Who?
Yes, sir.
Umoren J. Joseph.
Yes, sir.
Yes, you have the floor. Did I call another name? Did I call Stella?
This is J. Stella. Yes, sir. Thank you, sir. My good afternoon, sir. Good afternoon, my dear colleagues. Good afternoon, everyone. My name is Umarin J. Joseph. I carried out my practicum in General Hospital, Mina. And General Hospital, Mina is a government facility. It's a public health care facility located in Mina. That's the capital city of Niger State. It serves a major referral center, providing a wide range of medical services to residents of Mina and surrounding communities. The hospital actually offers outpatient and inpatient care, emergency services,
maternity and pediatric, and various specialist treatments like the mental health unit and the heart-to-heart unit. It plays a crucial role in delivering affordable and accessible healthcare to both young and old, and then the various challenges, including mental illnesses, contributing to the overall health and well-being of the population. So my practicum was carried out in the mental health department and in heart-to-heart department, where also HIV patients are affected with psychosis, causing them to come down with mental illnesses. So there I had hands-on real-life scenarios where I came in contact with people living with HIV and are also down with psychosis. And as a healthcare worker, I ensured that these patients, when identified during counseling with them, because during counseling, I'll carry out assessments and taking of history, family history, health history, medical history, and all. So, and the way they communicate with us, we know that they need to see a consultant. So we now aid in referral services. We'll now first of all contact our ART coordinator. Then the ART coordinator will talk to the patient, seems deemed fit, she will refer, and then I'll navigate the person to the mental health department where they will go and meet with Dr. Itopa, Dr. Garuba, the mental health consultant there. There I actually witnessed a lot of management of cases like depression, PTSD, ADHD, schizophrenia. But I'm actually going to talk about schizophrenia. I don't know everything. I went there as a student and I spent a few weeks, which will not be a yardstick for me to know everything. But the little I learned and, intervened there and interacted with is what I'm going to actually talk about. And I'm still learning more and I'll still continue to learn more. So is schizophrenia. So people that came down with schizophrenia, the interaction, the side effect, the signs and symptoms, and how to assess them, how to diagnose, and then the treatment, the management. And then the theory I actually used is the biosocial. Hello? Hello? I don't know if I can be heard.
Hello,
You
we
are
are
talking to
listening.
yourself. Hello?
I hear you. Please go on.
We are hearing you.
Go ahead.
Hello?
Umoren, go ahead. We can hear you. Go ahead.
Okay, so the theory I used, thank you, sir. Sorry, my network is kind of bad. The theory I used in the case of this schizophrenia to identify is the cognitive behavioral theory, which guides in the intervention because schizophrenia often involves distorted thinking, misinterpretation of reality, hallucinations, especially audio hallucinations, and then it influences emotions and the behavior of the person. So the application of this in that case is that it helped me to identify the triggers for these hallucinations, like what triggers these hallucinations in these patients, and it also guided me to reevaluate these delusional beliefs that they have, and then it also helped me to create a plan, develop a plan, like strategy, like to distract them from these triggers, and then to improve their medication via counseling and ensure that they adhere to their medications, both the HIV medication and the medication that will be given to them by the doctor for the illness, the mental illness, and then try to create social relationship, with try to encourage them to develop these social relationships because they have this withdrawal also. So the model I actually use is the psychosocial model. If using this biopsychosocial model for schizophrenia, it comes from biological factors because they have some biological factors that affect them. That's the dopamine. If there is secreted low or there's no secretion of dopamine, it's going to actually affect the brain. And then the emotional regulation, that's the psychological factors, and then the social factors, the family conflict, the stress, and the internal and external stressors, like maybe their financial statuses and all. So my role as a caseworker, when I identify those kinds of cases, I actually make sure I activate the referral case. That's referring to the ART coordinator, which I ensure that I follow up with the ART coordinator to refer to the mental health unit for further review. That's
Umoren. Okay, it's like, I don't know if she is done. I only wanted to ask her just one
actually
question.
what I do. That's what I did at that particular period of time.
Okay, Umoren, can you hear me? Umoren Joseph.
Yes, sir.
As a social worker who has had experience in mental health setting, what do you think can be done to address stigma associated with people with mental health challenge? Did you hear me?
Network has knocked her off. Huh?
Okay, can we have Shimon, are you here?
Yes, I'm here. Good afternoon. Am I audible?
Very well.
Am I audible?
Very well.
Hello.
Okay. Okay. Thank you. Sorry, my network. I thought I was pulled out. So some of the skills I acquired.
Umoren, can you listen?
I acquired critical thinking skills, education.
I wanted
Yes,
to
sir.
ask you. I wanted to ask you a question. Are you ready for my question?
Okay, sir.
Somebody that has had experiences mental health. My question is, what do you think can be done to address stigma associated with people with mental health challenge?
Yeah, creating awareness in the community, and then letting them know that because they tag mental illness as madness, and it is not actually madness. For someone to have mental health issues, so for somebody to be mentally ill doesn't make that person mad. So people tell me that. So creating awareness in the community is one of the strategies to help make people understand that it's not madness, it's actually a sickness. Because if we want to go by the definition of mental health according to WHO, then everybody would be called a mad person. Because according to WHO definition of health, it's a successful adaptation to stressors, both internal, external, environmental, and all, before anybody can be mentally sound.
It's okay. You can take it back.
Thank you, sir.
Richmond.
Yes, sir.
The floor is yours.
Okay. Good morning, sir, Ma, and my fellow colleagues. Good afternoon. Sorry.
Last time.
Good afternoon.
Go ahead.
Okay, my name is Richmond Ogeneke-Odiri, and I did my practicum experience in a non-governmental organization, Unified Culture Promotion Foundation, which acronym is UNIPF. UNIPF stands at the forefront of cultural advocacy. Their mission is to harness the power of culture as a fundamental to the humanitarian effort development initiative, peace building endeavors, and social integration. During my practicum, I was placed with the program unit for my practicum experience. And my first task was a challenging one because the organization was having an issue with the community they are implementing their program activities. It was a nutrition project, and the organization was helping the women in the community to grow a vegetable garden
Not be small word today.
where they can get fresh vegetables to increase their nutritional value in their homes. Hello, am I audible?
Go ahead. I've muted the person that is disturbing.
Okay. Vegetable garden where they can get fresh vegetables to increase their nutritional value in their homes and also create livelihoods for selling some of those harvested vegetables to get some other condiment like meat and other supplements in their meals. The men raised concerns, that is the community men, they raised concerns that they are not comfortable having male staff from the organization visiting their home in their absence in the name of monitoring the project activity. They are not comfortable with it. As such, the matter was reported to the community heads and gatekeepers. The organization was summoned, and I was tasked to manage the situation at hand. Having experience in project management with the training acquired in the institution as a social worker, I met with the concerned community and briefly explained the scope and objective of the project and addressed the matter at hand. I assured them the organization has taken steps in addressing the concern. I advised the organization to change their monitoring approach, that female staff should accompany the male staff to the field for monitoring. So the female staff should go in first, have a brief conversation with the beneficiary before the male staff can go in. Also, I suggested to them, instead of going in person, which was the former practice, they should work in group of 3, 2 female and a male, if need be. Having understood the importance of the project and the new strategy the organization is putting in place to see that their concern is addressed, they appreciated the organization for taking such a step. One major concern and challenge I observed during the conversation was that there was poor community entry by the organization. As such, the committee members didn't understand the scope and objective of the project properly. I recommended a training for all staff and volunteers on proper community entry and stakeholder management. I was also tasked with the responsibility of conducting the training. I also recommended that they should be intentional while recruiting staff and volunteers for this kind of project in future occurrence. Female locals should be more considered to gain acceptance at community level. Lastly, I recommended a regular meeting should be held with community members to discuss progress and feedbacks. As per challenge, logistics, limited resources because it's a self-funded project, and language barrier was major concern. I have to work with the local person there for interpretation because they have different languages there. Lastly, I supported the organization proposal team in writing proposals, and they got 3 projects before completing my practicum, which is a plus because these 3 projects will immensely add value to the identified community of implementation. For skills, I improved on my effective communication skills while working with them. Also, my report writing and proposal skill was also improved. Advocacy skill was improved, and my stakeholder management skills was improved. Thank you, and over.
So, thank you very much. Okay, thank you very much for your presentation, Richmond. When I was looking at the Unified Cultural Promotion Foundation, so my mind went to a whole lot of things. What are we going to do? Is it those in arts and culture? But I've listened to you. You've talked about issues that have to do with nutrition and nutrition promotion. And it is very key that we make use of our available local foods. We promote it, we put it around us. Is one of the things that will, reduce cost for feeding, give us variety in terms of the basic nutrients that we need. Then the challenges you have is a pure problem of community entry. Probably the organization did not do their baseline study very well, because if they have, maybe these are some of the things that would have come up, so that when they are now beginning to recruit those who will intervene in the project, it will not be the way it was. It's really a problem that young men will be parading in the community and trying to smart what men are doing. So thank you very much for your presentation. And I think that is all from me. You can go.
Thank you, sir. Most grateful.
Yes. Stella Willoughby, I hear.
Please, sir, can I present now?
We are your
Sir,
answer.
please, I'm here now.
Who is talking?
Cinderella, please. I'm here now, please.
You cannot present. You just wait. When others finish, you can. You cannot just do whatever thing you want. You barging on me and
I was
ask me
on the
that.
road, sir. Sorry, please. The network.
Okay, mute your mic. Stella Willoughby.
Yes, sir.
Go
Good
ahead.
afternoon, sir. Good afternoon, sir. Good afternoon, my colleagues. I am Stella Willoughby. I did my practicum at Lady Divine Orphanage and Charity Foundation, Ibesa, Ogun State. It's an orphanage that caters to orphans, abandoned children, children from broken homes who are brought there through court order, and differently challenged children. At the very beginning, they were also taking care of widows in the community. But the present economic situation in the country made them to stop the widows' outreach for now and focus on the children. They also do adoption, but adoptable children are allowed to be adopted through the Ministry of Women Affairs. The foundation has nothing to do with adoption. They just write to the ministry, tell them that they have adoptable children. So the ministry does the rest. Ministry of Women Affairs, Abeokuta. Because of my experience with normal orphans and abandoned children, because I have like 3 decades of experience in orphanage work. I grew up in an orphanage too. So I told them that I want to be attached to the unit in charge of differently challenged children. I have never had the opportunity to work with such children. So I was given a supervisor, the one who is in charge of that unit, and she introduced me to all the children. And after seeing these challenged children, I almost forgot the training I got here concerning the fine line between empathy and sympathy, because their situation touched me so much. But I was able to pull myself together. So while I was working with them, I didn't just stop working just with them. I was also helping them to take care of the other children because they gave me accommodation. I stayed with them every 3 days in a week. So I also helped with the other children and whatever it is that needs to be done. However, I noticed that in that my unit, there is this particular girl. Her name is Fatima. I noticed that she's isolated. She's always on her own, but a very clean girl, very clean, always wearing clean clothes on her own outside every time. She will never come inside to play with others. Nobody goes to her. Even the caregivers, they don't talk to her. They don't play with her. Nobody. She's always alone. So I went to my supervisor and I asked her, why is that girl always alone? She doesn't talk. She doesn't do anything. She now told me that she's deaf, she's a mute, and she's epileptic. I said, no wonder she has injuries all over her body, scars, and almost healed wounds and fresh wounds. I said, is that why she has wounds all over her body? She said, yes, sometimes the seizure will catch up on her when she's somewhere and she will just fall down and injure herself. I said, so what are they doing about it? What have they done for her so that she will stop being isolated and alone? She said that there is nothing they have not done concerning the girl, that she's antisocial, she's this, she's that. I said, I have never seen such a case, deaf, mute, and epileptic at the same time. She too said they have never ever had such a case in their agency. I said, but something has to be done. Why not do a referral to people who can handle it? She said that they've been trying, they've been writing to the government, this and that, nobody's answering them and all that. I said, okay, can I try? She said, what do I think I want to do? That I should not go close to her, that she has epilepsy. I know epilepsy is infectious. I said, epilepsy is not infectious. It's a disease of the nerves. That is not infectious. She said, some things used to come out from her mouth when she has a seizure and all that. I said, that is not a good reason for her to be isolated and all that. I said, okay, can I do something that I don't believe in epilepsy affecting someone else and all that? She said, okay, I can try. She said, what do I want to do? I said, well, I'm coming from the background of a professional institution. They have taught us one or two things. I will think about what I can do based on what we have taught. So I said I will observe first. And I started observing her. And I discovered that why she's isolating herself is because the other children would never play with her. They will never come close to her. Anytime she even makes any move to get close to them, they will all run away and push her away. And so I saw all those things. I said, okay, what do I do? What do I do? And I went back to my supervisor. I told her, okay, I want to use one theory that they taught us in the school, attachment theory, that I want to get close to this girl. Let's see if she can change. Though I cannot communicate with her because she's deaf, she's mute, and there's no way for me to communicate. And I don't know proper sign language, but I will try. She said, okay, I should try. And now the first thing I did was when I saw her outside sitting like that, I just went there, I sat on the bench beside her. She would turn and look at me and I will smile. I will smile very well. And slowly, she started smiling back. Slowly, she started smiling back with me. Then I will hold her hands. And I discovered that the day I first held her hands, she held onto my hands tight. Said, wow, this girl just needs somebody to get close to her. And I started encouraging her. Little by little, I will use sign language, smile with her, play with her, hold her up, and we start jumping around. I'll bring skipping rope. I said, with sign, we're just doing these things until I took her to the living room where everybody sits, but she will never agree to sit on the sofa. She'd rather sit on the floor by the corner of the sofa. It's something she has been doing since she was there. But, as God will have it, my getting closer to her, being sensitive to her needs, being able to, show her understanding, made the girl became free with me. Anytime she sees me, when I go on Wednesday, she will be so sad. When I come back on Monday morning, she will rush and hug me. I will hug her back. She will be holding my hands. But I knew there was a danger in that because I am not a permanent fixture there. I will soon go after 2 months. So I didn't know what to do again. Others were like warning me, don't go, what you are doing, you will become epileptic. I said, no, I will not. My supervisor herself eventually saw what I was doing, and she too started getting closer to the girl. Finally, I said, I want to know what this girl can do. So let me see what she can do, how we can help her in spite of her disabilities. And with that, I discovered that this girl can write very well. If she writes better than children in SS1 or 2. And then I said, people say this girl is 11 years, that she's more than 11. And it means that this are deaf and dumb, this her situation is not from birth, because apparently she has learned how to write and everything, but she could not tell us anything about herself for obvious reasons. So finally, one day she had an episode in my presence. It was really scary, but I gathered myself together and held her after we have cleaned off the whole vomit and everything. We took her to the hospital. These people, they had no money at that time, but I was able to do a kind of collaboration with the hospital, telling them where she's coming from and all that. They treated her freely. They examined her and they discovered that she has been sexually assaulted. Okay, let's say, I don't know if it's an assault. She's not a virgin anyway. She has been used, that. So we started taking care of her. After the hospital episode, we came back home. But I discovered that the children were still running away from her, with the exception of my supervisor and 1 or 2 caregivers. Those caregivers, they lack empathy and all that. So I discovered that that girl still staying in that place will not be okay for her. I went back to my supervisor. I said, what does she think we should do about this girl? Since she's improving, she now suggested that we do a referral or a transfer. So we started writing to the government to transfer her. I went to Abeokuta, did a lot of legwork and paperwork. So the paper came out, but they were yet to do the final signing before I left the orphanage. But when I called, later I called, I said, is Fatima still there? Or they said she has been transferred. And I was okay because I know in the government orphanage, they have resources, they have professionals who will help her. So that is about that case in that orphanage. One of the challenges I had in that orphanage is that they have more caregivers than social workers. I also discovered that there are 2 degrees of social workers. There are social workers, those who went to university to read social work. But there are people who are professionals, professional social workers. These are the people who really understand the work very well. I discovered this too. I also discovered that they have this challenge of resources. They don't have much. They used to, but they said because of the economic situation, people don't visit, grants don't come in like it used to. So they have this problem. And they have the problem of infrastructures, like a proper sick bay. They don't have there. And then by the end of the day, I told them that these are things that they need to work on. I know I am a student. I was telling my supervisor, I'm a student. I am not really, I have not been certificated to offer all these advices, but where I'm coming from a strong background because where I studied, where I was taught these things is a very strong place. So they really need to work on all those things. And they have network issues there. If there is a problem in the night, you want to make a call or something, it is very, very impossible. That's another problem they have there. But I learned a lot too. I learned that when you are taking care of the physically challenged, don't see them as people who are hopeless or useless. Because in every disability, there is an ability. Fatima's case is a pointer. That girl can write. If she writes, if she paints, you will not believe that it is that same girl that is doing all these things. Thank you, sir.
Thank you, Stella. You have a very beautiful presentation, but I want to know, who is Fatima?
Fatima is the girl. They gave her that name at the police station because according to my supervisor, I said, if she cannot speak, she doesn't hear, she doesn't speak. How did she get the name? He said, oh, it is the police that gave her that name when they were writing her abstract. Say she looks like a northerner. So because she's black, they now gave her the name Fatima.
Now, so which means everybody in that home knows her as Fatima.
Yes, sir. Everybody knows her as Fatima. The police, even the welfare office, the regional welfare office.
Now listen, you have breached a very serious aspect of confidentiality.
Okay.
Did you hear that?
Yes, I understand, sir.
Are you sure?
Yes, I shouldn't have mentioned her name.
I don't know for you, so you have breached a very serious. So with all your beautiful report, that mentioning of Fatima, you're emotionally carried away by the works you do. We need to be very careful on issues of this nation.
Yes,
exactly. If I didn't tell you here, tell you. And if I want to be carried away by your beautiful presentation, I'm not helping you, I'm not threatening you. So you need to be careful. So that you can also see Miss A or candidate A. That's take care of the person's name. Because what it means, go to that facility and mention Fatima. Many people know about that name, Fatima, which is a very serious confidential issue.
Okay, sir.
Yeah.
I understand, sir.
That's all right.
Thank you, sir.
You're welcome. Oluwatoyin Abidemi, are you back?
I'm here. I'm here, sir.
Okay. My agency for the provision of trafficking in person.
Good afternoon, sir. Good afternoon, my lecturers and my colleagues present. My name is Oluwatoyin Abidemi Omonaye, and I did my practicum at the National Agency for Prohibition of Trafficking in Persons, as a NAPTIP. I was there for about a month plus. NAPTIP is an organization that enforces laws on trafficking in persons and related offenses, and they adopt effective measures for prevention and eradication of people that are trafficked. They also established coordinated and preventive measures, regulatory and investigatory machinery towards eradication of trafficked persons. Their major objective is to investigate. That's their sole responsibility is to investigate and prosecute perpetrators of trafficking and modern slavery, and also rehabilitate the victims. I started work at a place when I resumed at the headquarters, which is in Wuse, Zone 5 in Abuja, FCT. And there I was introduced to all the staff in there. I started off work at the head office, the office of the deputy director, where I was asked to start up with registration of cases, because the NAPTIP itself, they have a lot of cases. Like sometimes in a day, you could have up to 15-20 cases coming in, and cases coming like at interval, different times of the day. It can be in the morning, afternoon, night, different cases from various places. So we have cases of people that are trafficked. We also have cases of people that are molested. We have cases of people that are abused, children, teenagers, adults, and all that. For example, some of the cases that we had case of kids, a child that was kidnapped, and they found her in a Dangote truck. Another baby was trafficked from the east. Mother beat her up. They took her to like a religious center, where they incised a lot of things on her body. So she had all kinds of marks from her head down to her feet. She had a lot of wounds there. We had a child that was also trafficked from Ondo. She was maltreated, and then somebody just helped her. Like it was a neighbor that helped her to come in. There was cases of a girl abused by her father. There was cases of exploitation of children that are taken and then were being trafficked out of the country, and then probably at the point of leaving the country. The officials there at the airport now discovered, and they started investigating. So the moment they just see those ones, they return them back and they send them back to the office. So I worked to the head office, just like I said, and recorded a lot of these cases. And then after a while, I was transferred to the shelter. It's called the shelter, where they keep persons, their victims. So mostly at the shelter, we had a lot of children, teenagers, and a little few of adults. So the idea of the shelter is to, whenever the cases come in and they are registered, they have an investigative officer who does a letter. He picks up a case file and puts their names and details inside, because it's supposed to be as confidential as possible. So all the details are in the file, and then forwarded to the Director General, who now gives a go-ahead for investigation to take place. So I was transferred as a counselor. So whenever these cases come like that, the case can be referred to you and they expect you to handle it. But of course, as a first timer, I just looked at the whole thing. I had to observe some of the senior staff and people that were already working there. And then over time, they started giving me cases to handle. So whenever they come, we did counseling. We started off with counseling. There was one-on-one counseling. Then we also did like a group counseling for some of the children. Like the ones that we did group counseling for were for those ones that there were 5 boys that were being trafficked by their uncle. He said he was taking them to go and get jobs. And these boys were just between the ages of about, I think the smallest boy was 9, like 9 and 14. There were 2 of them, there are 2 sets that are brothers, and then another one. So they were all together. So when we did counseling, we had to counsel them, explain everything to them, because they actually didn't know what they were being taken away for. So We had time to talk to them one-on-one and then explain to them. So like from the register, because we had a way of registering all the information that we get their own part of the story. And then the person that was trafficking them, of course, had been arrested. Usually they are sent to the head office. The head office handles all those cases. So those ones at the shelter, the ones that we handle. So they are called the counselors that handle those cases. So whatever information we get, we put into their files and we discuss it, whatever can be done. Those that we need to contact, like if you have to contact their parents, you contact them. So they go through the rehabilitation period for 2 weeks. And after these 2 weeks now, if one can get across to somebody, they get them across to their family and rehabilitate them back to their family. But we also had cases of people that have been there for like between that 2 weeks and sometimes as much as 3 years. In fact, there was a case of a girl that stayed there for, they say it was 15 years. Now, because the girl, she couldn't communicate, they don't even know where she's from. She's deaf, she's dumb, but she's she learned skills while there at the center. So she can make hair and do all those kind of things. So that's what they encourage her to do. Now, because where it was a closed shelter, most of the children, the victims in there are not allowed to go out. They don't associate with people outside. But there are other shelters like the Watcliffe and then Market. Those other shelters, whenever they have some programs, they are invited in. So they take them to maybe to a venue. It could be at the head office. It can be at any place, so they transport them in vehicles and take them there. So we have their counselors. Like while I was there, I had like about 5 people I was counseling. So anytime they had any outing, I had the responsibility of taking care of them and ensuring that nothing happens to them and things like that. So they go and then we care for them and bring them back to the shelter. So the ones that we're able to work with and rehabilitate, we connect their families. They come, they sign undertaking to ensure that this child is safe. But anyone that we see that do not have persons they can relate with, they will still have to keep them inside in the shelter until a solution is found. So usually when they get to a particular age, because they school in the shelter as well, everything, all the facilities is within the shelter. So if they get to a certain age, secondary school age, they move to the other open shelter, which is a Watcliffe. Because most of the ones within the shelter that I worked those was in primary school. So I learned a lot. I learned a lot of things. In fact, when you hear some cases, you will never believe that these things actually happen. So you hear cases and you're so touched. Sometimes you'll be listening to stories, you'll be crying, you get really touched because some children have gone through a lot. So looking at the whole thing, although we had a few problems of, counselors are never enough because they had too many cases. And then sometimes also have challenge of feeding and all that. Maybe they're unable to provide on time. It takes some time. They don't dress well, clothing and all that. So the one I was able to just pick up some of the children. I brought in clothes for them, but to do all that too, they don't allow people. You're not allowed to bring in things for the children. You have to write, or you have to meet them at the head office to tell them that this is what you want to do. So there's a restriction from people bringing in things for them because they say it's a temporary place, so they are not expected to stay there for long, actually. So like I said, I learned a lot of things. I learned to be more patient, to understand people's background and where they are coming from, and to be able to deal with them, especially. So I would say that the crisis intervention theory is probably what we adopted mostly, and that provides immediate support and helps to stabilize and rehabilitate the victims. And then systems theory too, it also helps you to understand the persons themselves. So when you speak with them one-on-one, you can understand what they are going through and where they are coming from. And that also helps you in the process of rehabilitation. Recommendations that I would recommend more training for the staff, because while I was working, I think that there are some of the staff. Hello, sir.
Your recommendation and conclude.
Okay, sir. So I noticed that some of the staff are not patient enough to listen. Sometimes when the children are trying to explain that this is what happened, blah, 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 they are shouting at them. They are not being patient. They don't have this empathy, maybe because they've seen too many of the cases. So, and then sometimes you realize that some of the children tell lies. They just come into the shelter and say all kinds of lies. So they find it difficult to believe them. So I think that was one of the things that they had. So, well, we recommend that the government will need to provide more of those kind of shelters, because the shelters actually look congested at some points. They have one clinic and they usually have one or two not in. So when those ones that had injuries, they are treated at the point of entry. So I think that's a basic thing.
Okay, but to you, Nabidemi, thank you very much. You've given us a very elaborate and a comprehensive report from NAPTIF. Okay, we can be, yeah, you can. I don't think I have any question to ask you. Some of the things you said came out very clearly. So you can go. So I'd say you can take a bow, if you can hear me. Johanna Rachel. Johanna Rachel.
Yeah, good afternoon, sir.
Good afternoon.
Hello, sir.
Yes, I'm present. I'm present.
Hello, sir.
Who is speaking?
Joanna Rachel is here, sir.
Okay, Joanna Rachel. Gender Perspective and Social Development Center. Can you please go ahead?
Johanna Rachel, but the other person is still talking. She hasn't. I don't think she has ended or she has muted her mic. Okay, the registrar, the Practicum supervisor, distinguished ladies and gentlemen, Johanna Rachel is my name. I did my practicum exercise at Gender Perspective and Social Development. Gender Perspective is into gender equality, sexual and gender-based violence intervention, social justice, empowerment, and the empowerment of vulnerables, basically. So while I was there, I practically joined in virtually everything they do in the organization. Gender Perspective is a non-governmental organization. So I joined in everything, every intervention that took place there. But there's this one I had to follow up till date. I am still on it, despite that my term with them has ended, but we still have that relationship because that's an intervention that I personally handled, and there was no way I could break free. That young girl, 16 years old, was staying with her mom and the stepfather. So the aunt called us from US and told us that we needed to intervene, that girl just confided in her that she's been sexually violated. So on getting to the place, I was asked to go and pick the girl so that we can know how to follow up her case. I picked the girl, and then when she was talking to me, she was crying. She told me everything, that the stepfather has been violating her from when she was age 11. And now she's 16. It became a very difficult one for us because the court will always expect some form of evidence, and then there's a way the High Court will look at technicalities and all that. So it was really tough. I had to do collaboration with some of the staff there. We did a lot of teamwork to know how to go about it before we now went to the police station. But even to get to the police station to arrest the man, the girl said she doesn't want to continue with the case. It was tough. At that point, they told me to follow her up and see that she doesn't back out. I now had to speak with her and make her understand that I am also a survivor of abuse. I did not have anyone to intervene during my time, but I grew up knowing that this is a fight I want to take. And if she wants me to help her so that we can help other people, she should please allow us to arrest this man, that justice has to take its course. And if she doesn't get justice, she cannot get closure. She now accepted. We now arrested the man, and right now the case is in court. The man is remanded in the correctional center. But I faced a lot of challenges. One of the challenges was the police station. Because some police stations do not have the jurisdiction to carry out some cases. You have to, from that police station, move it down to the state CID. Those police people were almost cutting off our neck transportation. They will ask you for money for the men that will follow you to go for the arrest and all that and all that. It wasn't easy, but her aunt abroad was paying for that because the organization cannot afford that. They are still struggling on little although grants. We had to give police those little things. Then to move the case, I also had an issue of police. Those police stations in that first police station had to even kill some of our evidence. But thank God, during the interrogation, when they were interrogating the perpetrator, I also was recording. The policeman tried to make me not to record, but I told her, I gave her sign that I need to. They couldn't erase my own evidence, but hers, I think she paid them, they paid her and she erased it. But I still carried my evidence down to state CID, and it assisted us to get to, because right now the man is at the correctional center. The girl now, we had to remove her and her younger brother. In fact, they have 4 kids in that house. It's a one room that they stay with their mother. The girl told me that she has told her mother from the very first day that the man touched her in that one room. But the mother just woke up and scolded the man. And that was it. But the man has continued from age 11 till now that she's 16. So we agreed with the aunt. The aunt now immediately puts the girl and her younger brother in a boarding school. Then the 2 small ones, they kept them with another aunt. But before then, we had to take all of them to the sexual assault referral center to go and run a test. Because the man was not only having vagina, he was also having anal sex with the girl. So because of that, we needed to also run the test on. To God be the glory, the other 2 children came out very okay. So yes, my recommendation they need to collaborate more, refer more, because local community and the people kind of build some kind of trust with the few cases I handled and that of the girl. It wasn't easy, but somehow we're able to get to that. So I recommended that they should refer more. If they refer more and people can connect to the victim, that they will have a lot of cases of their neck because they're actually overwhelmed. I have not dropped that case. I still have to follow that case, keep communicating to close the case, but it's not possible because they have someone that's following it up. So that's when.
Johanna.
Thank you, sir.
Okay, you are done.
Hello?
You are done.
God, I hope I've not been talking to myself. Hello?
Yes.
Yes, sir.
You are done.
Yes, sir.
Okay, thank you for your report. And
I'm done, sir. I'm done, sir.
Yes, can you hear me now? Can you hear me?
I can hear you, sir. Yes, sir.
Okay, yes. Thank you for the wisdom of having a plan B. If not, maybe they would have killed the evidence and nothing would have happened with that case. You know, and for you worked with an NGO, say Gender Perspective and Social Development Center. Now, police is supposed to protect the vulnerable. The police has an evidence to protect the vulnerable. The same police decided to kill the evidence against the vulnerable. As a social worker, what kind of collaboration be done so that when we do this work, because we have been hammering about multidisciplinary approach, synergy with relevant stakeholders. If you work with this kind of stakeholders, what it means is that they are going to frustrate the work you do. So from the experience, what do you think? So that stakeholders working as a team or forming a synergy to fight a particular cause could work in trust and in confidence with each other.
Okay, sir. For starters, when we discovered this threat and killing of evidence, we discussed it and decided to go for advocacy to the Commissioner of Police. We felt that we needed the higher authority to be able to address it. because no matter how their organs try to address this thing, these people still find a way. But then it's reducing. According to gender perspective, there was an advocacy they did with the deputy commissioner at the state CID that even made them to now reduce, like, transfer cases without even calling for too much money. So we had to now go to the commissioner of police to lay this complaint that there is need, and also tell them that there is need for us to have more trainings. You know, in gender perspective, they used to have some international organizations that come to do training for staff on different things, training for, let me say, police statement taking room and all that. So we're advocating that more policemen should be sent to come for that training, and then their commissioner should please try and call them to order, you know, and kind of send a signal around that sexual assault cases are very, 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 they are very, very, I don't know, but then it's not something anyone should, it's sensitive. They are very, very sensitive. It's not what anybody should play.
Okay.
So that was the step we took to get to the commissioner of police to address it. Hopefully. Hello, sir. Hello. I can hear you. It's faint.
I don't know why it is faint.
It's
I
very
think
faint, sir.
Is it okay now?
Okay, I can hear you now. I can hear you now.
Okay.
Yes, now it's better. Very clear.
Okay, I'm trying not to be gender sensitive. I ask here, but I want to find out that police person, is he a male or a female?
He's a female, Oga. He's a female. Female police officers are the major problem we have in this country. They don't act like mothers. You know, he's a female.
I wanted
it's sad.
If perhaps
line is breaking again. I can't hear you again. Oh, kind of. Why is this line?
Okay, Sandy Tolulokwe Christian, are you here? Tolulokwe Christiana.
Good afternoon, sir. Sonny Tolulokwe is here, sir.
Please, Minister of Women Affairs and Social Development, Ibadan, can you bring us up to speed to what the things you have done for the past?
Okay, sir. Good afternoon, coordinator. Good afternoon, Dr. Kemi and my colleagues. My name is Sonny Tolulokwe Christiana. I had my practicum at the Women Affairs, the Ministry of Women Affairs and Social Inclusion, Oyo State. The Women Affairs and Social Inclusions is a government agency responsible for promoting the welfare and development of women, children, and vulnerable groups in the state. Some of the duties is a formulation of policies which promotes gender equality, social inclusion, and empowerment of women, children, and the vulnerable persons. Also, they do advocacy for the rights and interests of women, children, and vulnerable groups. Also, they are in charge of child adoption, adjudication of cases involving children, repatriation, and reintegration services. I learned under the Office of the Director of Child Welfare Department. I did my practicum there, and one of the, among other several cases in which I was actively involved, was one of a sexual abuse of two subjects who were siblings, ages 8 and 5. The case was brought in after a long time. It wasn't immediately the case was discovered that it was brought to the ministry. The case was brought in when the perpetrator had already absconded, and it was brought in by a social worker and the mother of the victims. It was reported that the community leaders had asked the youth of that community to discipline the perpetrator, and after that, the whole thing was swept under the carpet until that social worker in that community caught wind of it and brought the case to the Ministry of Women Affairs, and alongside the mother of the victims. During an interview with the mother of the victims, it was observed that she also is mentally unstable, and she couldn't really comprehend the havoc that was done to her children. The victims, they were brought into the child welfare department and taken for medical investigations, including HIV tests, which after the investigation, the results actually stated that the older girl was actually penetrated, and the younger one too was defiled as well, but with fingernail scratches and bruises in the private area. Afterwards, after the results of all this came out, the community leader representative and the mother of the perpetrator, the perpetrator actually is the stepfather of these children. Hello, can you hear me, sir? Hello?
Go ahead.
Okay, sir. Okay, so the community leader representative and the mother of the perpetrator were both invited to the ministry, to the child welfare department. And while the director was having a conversation with them, actually the mother of the perpetrator came prepared with drama. Actually, she came and pretended to have collapsed so that she could be let go, and because she claimed she too doesn't know where her son is, and she pretended to faint. Let me say that. So some of us initially panicked, but based on practice experience, we had other people the staff members who were there, and they were not faced by all the drama. So they just told the woman, "Mama, just get up." And as if nothing was actually happened, the woman got up, ill and agile, so it was all a drama. So knowing they asked for the son's phone contact. She said she doesn't have a phone, so she doesn't have his contact. But later when they asked again, she said there's no power on her phone. So, "Mama, bring the phone, we will charge it." So we did that as the old thing. We took the phone.
Can you summarize it?
Okay, yes. Okay. So eventually, we discovered that the mother was in touch. Actually, even up until that very morning, has been in touch with the perpetrator, only claiming to not know where he is. But the children were eventually, the woman was handed over to the civil defense officers to carry on their investigations in order to, apprehend the perpetrator who had absconded. Then the victims were taken away from the mother because it was observed that even she herself, she is a victim, and the perpetrator had targeted her because of her mental instability and had taken advantage of her and the children. So the children were taken away from her, brought to the child welfare department, and after then, they were temporarily placed in a home where they could have a proper protection and care, and as well for the time being, continue their education from there. So the intervention that was given to the victims, medical intervention, as well as psychosocial intervention, because therapy, because at some point the older child became emotional and she doesn't want to go to the home. But I also was privileged to be one of the people that spoke with her, telling her, assuring her that where they were taken to is a place where they will be taking good care, their needs being met, and nobody would have any reason to take advantage of them in that manner ever again. And after that session with them, she became cheerful, and they were handed over to the representative of the home where they were being taken care of. So I would say the model that was employed in this case is the model that was being employed in this case is an informat model, which is crisis intervention model. And I would say also that the challenges I noticed during my practicum in the ministry is constraint of fund, then logistic challenges, because there was really no standby vehicle to take the staff around. So they had to probably call the home that had to do, and that had to come and take them before they go to such places, or to go and pick the victim. So I think those were two major challenges I noticed at the ministry. Aside that, I think they had other things under control. So that was my experience, sir.
Thank you very much, Lokpesani. I don't know. Yes. I don't know why I have a feeling that you open a book and you are reading out as if you are reading a novel to me. Is that how you talk?
No, I am not reading actually, sir. I'm not reading. I couldn't read all of that. The report is going to be a long one. It were to be a report I was reading. That was just a summary. I just summarized everything.
It's okay. So, Minister of Women Affairs and Social Inclusion.
Yes,
but that is your destiny. You talked about your challenge. This challenge you are talking about, is this challenge that government will address? Or is it the one social workers?
I think is a challenge the government have to attend to, because it's actually the challenges of social workers and all the staff members of the ministry. So I don't think it's something individuals could, like the issue of funding. Sometimes I realize that they had to rally around among themselves. Even sometimes we had to, give a hand to do certain things that needed done when there was no provision for funding for such. Maybe there's a case like that needed urgent attention like that. There's no standby vehicle that could take them around and all of that. Yes, sir.
I'm going to school spend their money on Practicum.
Sir?
You have joined those who spend their money on Practicum now?
Actually, it was maybe just a one-time or a couple of times. It's just, of course, when the staff members were doing it, if we want to duck our head, it might look like. So it was just a one or a couple of time thing, not a, it wasn't a no. I didn't make it a no.
I don't know what you mean by norm, but that is fine. You can take a bow. You
Okay,
among
sir.
people who do
Thank you,
practical
sir.
spend their money because they want to. Yes, you are already Redeemer's Health Village. Are you here? Yes, Benjamin.
Yes, sir. I'm here, sir. Since morning, I've been here, sir.
Me, I've been here since this afternoon.
Yes, sir. Thank you
How
very
are
much,
you?
sir. Fine, sir.
How are you? It's
Fine,
okay.
sir.
Can you bring us up to speed on the things that happen in the Redeemer's Health Village?
Thank you very much, sir. I want to appreciate you, sir. Dr. Fadila Onoja, thank you very much for, I've been following how you've been following all of our colleagues since morning. And I also want to thank me and my colleague as well. Redeemer Health Village is a comprehensive health care facility that is committed to delivering exceptional medical services. It was actually designed for state-of-the-art that would be able to compete with a world-class medical system. And of course, within that space of being there, I realized that it was something that everybody should know about because Redeemer's Village is actually situated around Mowe, Ibafo Axis in Ogun State. Having arrived there, I realized that there are several platforms that have been created there. I was able to, when I got there, I was admitted by the HR and I was introduced to the patient experience unit, to the manager. And then the very first day, they took me around all their professional angles, introduced me to them, given of their consultants, and thereafter, the following day, I was privileged to witness their ongoing professional training. So I asked them if I could be part of it. They asked me why not. So I joined the ongoing training where they were discussing something that are very, very important. And there we learn, and they allow me, they give me the privilege to learn. And I learn in that place. They are what they consider as the pillar of clinical governance. And talking about the clinical effectiveness, evidence-based proactiveness, that before they approach any of their patients, they must have an evidence, which means such a patient walking to the facility but have gone through several tests, and they must have a concrete evidence before they can proceed on any medical attentions. And then, of course, talk about the patient experience, the feedback of the patient, and then listen to their complaints. They move also to, in that teaching, they also actually taught us about the impact of clinical deliveries and quality improvement. They talk about risk management and accountability. Risk here in time of either minor procedure or major procedure, that whoever that is involved must understand that they are dealing with life and they must know how to manage the risk that involve in their clinical approach. We talk about the leadership and governance. And of course, let me talk about some of the things I was privileged to handle when I was there, because I was allowed to, every morning we will go through the ward round. We'll move through the ward round, we'll listen to, and one of the principles I made there is that whenever the patient experience are doing their ward round, the doctors are not allowed to be there, the nurses are not allowed to be there. They want them to speak to the patient directly. So we'll speak to the patient directly. What are their concerns? What do they appreciate about their clinical attentions? Do they love the food they've been served? Do they have any problem about the food? And some of them have a complaint about their diet, that they are not listening to them or what they love to eat. They just brought them any kind of food. So from there, any report we gather together, we'll move quickly to individuals that are concerned. If we are to meet the dietitians who is recommending to the kitchens how they must change, how they must relate with the patient and know what individual wanted before preparing them their meal. And of course, we also moved quickly to listen to some of them. They've done their tests, and then the report was not fast forward to the doctors. And so because doctors are not getting the report, so many hiccup along the way. So we are just like an intervention between the clinicians and the patient. And we report directly to the COO, that's the Chief Operating Officers. So we report directly to him. So after the first week, the third week, they allow me, in fact, they have to move somebody away from our department to another department, to pharmacy department, to go and stay there, saying that they have enough hand now in patient experience. I told them, I'm here to learn from you guys. So we're there together. And some of the cases I handle is the case of the fact that I find out that some of the patients have a complaint of how they are being billed, their billing system. If any of the consultants just come to visit them in the ward round, and the nurse will just bill them that such professional has visited them. And then you see them, they start having a problem with them. Maybe, for example, we have a cardiologist coming to visit a patient. You don't even know if it was just a word round from the cardiologist, their own part, and the nurse assume that the patient should understand that these are professional body. They're coming to you to ask you 1 or 2 questions, they will be billed. And this build a huge bill. So when those complaints, I heard about the complaint, I had to speak with the manager that these are not right. That's one of the reasons why I'm here, also to learn from them, also to respond to some of these things that we are here about how the patient, how people will be able to enjoy whatever they wanted to enjoy and what they paid for. And there should not be any system of exploitation in disguise. That before you can charge somebody, the patient must be aware that they need so person. There must be an understanding between the patient and the nurses, and then before those people are coming. And before you are sending the bill to the record, because bill are just forwarded to the record, all those things, they are all automated. So once they visited their room, they are automated immediately that social person have come into this social place. It has sent information to the account department. The bill is rising. So those things were able to intervene, and then we solve sort of the problems. Another thing again, I also see there, after I've learned, of course, I learned the fact that I learned about how we could see different field of those professionals. Somebody is coming, for example, that's coming for just dermatologist, talking about those doctors that look after the skins. And if they come, there's a way that one must be able to identify them, that those outpatients who are coming to meet these professionals, and what the appointment, had it been a PPO call and all that, and how that appointment must not fail, because the doctor must have been pre-informed that you have an appointment, and that's not the time for you to walk away from the hospital. And so those things were carefully guided and then improved upon, because I have a lot of complaints when I got there that the problem here is at time. And I said, well, that is the problem we normally have in our country. You go to the general hospital, you see time, you spend hours there. So I make them to understand that, please, I think one of the things that we can do here is that you can start monitoring people's time when they start stepping to this facility, from the gate to the record, to the receptions. Time is counted. Each individual or patient should not spend more than 45 minutes, except they have a procedure. They have an appointment, which will take some time because of those things they need to be engaged with. But it should not just be in the usual practice or wasting people's time. And then it was improved upon because we do our regular update, checking our details and all that. And then we also have what we call follow-up on patients leaving the hospital. Follow up on them, getting their feedback. Another thing again I also see there is the fact that I learned is the complaints about the atmosphere, the ambience. Not that the ambience was not beautiful, it was beautiful, but because maybe because the place was built around there's some little swamp around there, so there are a lot of complaints about mosquitoes and all that. So people are being treated, and after a few days they are returning back again. So I have to meet the facility manager. I took permission from my manager. I said, look, sir, this complaint, man, I think we should have engaged with the facility manager. Let them tell us how they are going to be treating these facilities. Now you cannot go into those rooms, especially the general ward, and begin to apply any insecticide, because some people have a respiratory problem. So not everybody can be exposed to such, but there must be a particular time where you are going to treat the environment so that people will understand that they are not coming to this place being treated and go away again with another sickness. And of course, they started working on that. It was fantastic. Now, then we also look at the challenges I also saw there is some people, they actually have a need for these facilities, need clinical care, but they don't have the fund. So
Can you summarize?
All right, sir. Okay, I approached my manager. I told them, can we have all? Hello, sir.
In the next 1 minute, summarize.
Okay, sir. So I met my manager that is it possible for us to have a kind of a social welfare post for those who are vulnerable who need clinical care and they don't have money? And they of course said, well, we can do that. We have a meeting with the account managers, and they said, okay, I can put into writing. And I said, okay, they can put into writing. I said, they know that I have a limited time in this place. And they start working on that. They just said, well, there will be abuse everywhere. Abuse is inevitable, but it can be controlled. And so that we were able to do that. And then the theory I applied there is what I consider to be a very important aspect of biopsychosocial model. Because it had to do with the physical body, it had to do with the social factors, it had to do with the psychological factor of our total well-being being treated. Thank you, sir.
Okay, yeah. Thank you very much. Thank you very much, Benjamin, for that elaborate this thing. So you worked in a medical setting, and these are some of the challenges that you face. There is always a kind of consideration for indigent clients, especially in a hospital setting. But it should come when there is need. If you go and open a pool to be giving money to those kind of people, everybody that comes here becomes vulnerable. And because our people like our wood too much,
that's true.
They would like to always go to that place. So that by the time who genuinely need those help and those support, by the time they will come, there will be nothing left for them. So these are some of the things that when you do, you need to apply for some. But by and large, I appreciate the report you are giving so far.
Thank you very much, sir.
Okay. So you can take a bow.
Thank you, sir. Bye, sir.
Yes, I skipped somebody that was on trip. Maybe Cinderella, are you here?
Yes, I'm here, sir.
Okay, because you did your practicum in Nigerian Security and Civil Defense Corps, and another person again,
Yes,
Florence, did the practicum in. I'm taking the two of you at once. I have to push him up so that two of you will take together. Serious. President, are you here?
Yes, sir, I'm here, sir. I'm here, sir.
So, ladies first. In 2 minutes, tell us what you did in Nigeria first. Then let me get
it. Good evening, the Potem Registrar. Good evening, Mr. Ferdinand, my practical supervisor. Good evening, my fellow colleagues. My name is Edin Rivera Cinderella Mekwe. I did my practicum at I did my practicum at Nigeria Security and Civil Defense Corps, Delta State Command Headquarters, Asaba. We focused at the Intelligence and Conspiracy Unit. The Nigeria Security and Civil Defense Corps is a paramilitary agency responsible for protecting lives, properties, and critical infrastructure. My practicum aims to apply social work skills in a security-focused setting. There are a lot of cases that was handled by us, but I want to pick a particular one that we did on the 18th of June. A case of sodomy of a boy of 11 years and 9 years. What happened? The method, as in the theory that I used, was a ecological system theory developed by Bro naira. This theory view individual as part of interconnected systems. Why I said so is this boy of 11 years live with the parents in the house. He has a phone. He gives the phone to his brother, thereby taking advantage of the brother. Then what happened again? There is their neighbor's son of 9 years old. He brought the boy to the house and gave the boy his phone. And he started sleeping with the boy through the anus. The boy could not complain because if he does, he will not give him his phone. This theory that I used was applied by assessing the individual's immediate environment, including the family dynamic support system and potential risk. I noticed that some of the parents, they don't really pay particular attention to what their children are doing at some particular point. This very case was referred to the agency from the police station. So we were asked, we being the practicum student, we were asked to work on the children. So during my course of intervention with him, the boy made me to understand that he refused to tell the parents what was happening because he would not be given that phone. But when it was later noticed, they made an arrest. There's no way they could put that boy in the police station. They now brought to the agency. The agency asked us to take the boy to an orphanage home, which we did. The challenge we have was that because of taking the boy to the orphanage, we had to take public transport. There was no particular vehicle at that point. The one that was available, they said there was no fuel in it. Those were some of the challenges that was encountered by us. And I now recommended that I think they should, next time handling such case, there should be proper logistics, whereby before the child should have been brought to the station, to the agency where they involved us, because we are practicum students. They are the one that we are working with. They should have made proper arrangements, because that process of we taking the child on public transport, people now tend to know what the situation was, but we just kept mute. So we handle a lot of cases, but this particular one at the time when the case, when we made recommendation, I had to go to the home, the boy's home, and because the boy of 9 years, the father was insisting that the matter will be charged to family court. So the other boy now said that he watched it through phone. They discovered this through phones that they are watching. That was how he was watching it through phone, and he felt it is just normal like movie. He never knew the implication of it. So on another occasion, when they were having a PTA meeting, their own school, Mr. Lawrence and I, we went there. We had interactive session with the school, and we made our own recommendation that this kind of thing should be discussed in their school, because it is a village school. They brought the boy, they brought him from the village, not particularly Asabaye, but the case was transferred. So those were one of the cases that we handled, the case of sodomy.
Hello, sir. Good afternoon, sir. Good afternoon, the Program Register, other lecturers, and fellow students. Yes, there were other cases as well. Okay, let me just go direct to the cases. Now, there's a case that came to the agency, or about 2 teenage boys who had carnal knowledge of a 6-year-old girl. You know, the case was taken from a locality somewhere in Delta State and brought to the headquarters. So because the case was kind of serious, the case had to also be incidented with the police headquarters in Asaba. More so, as we were busy going about the case, you know, the police now kept the boys in custody, and these boys were teenage of 13 and 14. They were kept in custody. So we had to inform the agency that it's not even good to leave those boys at custody. So we had to go to the Women Affairs to get permission to transfer those boys to a foster home. And actually, that was the length of that day. We had to do what we can to transfer those boys to the foster home. So the caregiver at the foster home complained that overnight the boys were busy crying, but they were restless. So we had to go back the next day for a session. So we had to be with the boys for a long time we use social learning theory and behavior theories to try to find out what is the root cause of those things. So we were asking about their family standard. One of them said he was an orphan that was living in their family compound. The other one said he just have a single parent, which is his father, that maybe goes to work, sometimes may not return. We were probing and asking to find out what particularly was the root cause of this issue. But we discovered that the girl was living in the same environment with them, the little girl. They just took advantage of the girl. But the police threatened them that their case will be transferred. That's why we need this session. The boys were restless because the police told them that their case will be taken to court. So the boys were afraid that they were going to prison. So we had to counsel them that they are not going to prison, that they are minors. And because the Children Correctional Center in Delta State is far away, it's in Saple, away from Asaba. So that's why they had to be kept in foster home here in Asaba. Then these boys, the case, we had to take our time trying to walk them through, pulling them, trying to find out their family history. We discovered that the boys, they had a lot of freedom, you understand, from parenting. Now, we now start talking to them that what level of education, they say they are both in JSS3. So we had to do a lot of counseling, trying to tell them that, look, it is okay that even if they are wrong in their actions, that they can overcome this thing and focus more in life and progress better, that they should not be afraid that they are not going to prison. With all this talk, but the boys were still insisting, and we said, no, you're not going to prison. Just relax, you are minors, you can't go to prison at this age. So much time, we had other cases too, but I'm just being particular about this case because these boys, unfortunately, after our session with them, they calmed down and they were reasonable. Only unfortunately for us, the next day, we were told by the caregiver that they escaped from the foster home. So from this, I had a more experience at counseling session. Where I work, we really don't do counseling. We do more of intervention programs. So now that I see a new side of social work, I now began to see that there are more things I can do to gain more. I gained counseling session. Even in the agency, we gained reporting systems on case. Yes, sir. Okay.
Okay.
So
wait. I'm listening to a particular case.
Okay.
And when you are giving your report,
okay,
something struck my mind, and before I know it, you now said that the children now escaped from the foster home.
Yes, sir.
It is within the law. Children don't go to jail. They are not sent to jail, is it not?
Of course.
Now, sometimes there is a way we communicate our information or our knowledge. It will come out the wrong. If you are not assured that is not going to prison as a result of wrongdoing, what kind of signal are you sending?
No. I know there is correctional home.
Can you listen? You can, if you have worked on the child on behavioral change, on how to change his or her attitude, and you are now based on remorsefulness and willingness to change, and you are now working on the child that based on your intervention, that he will be given a second chance, that he should make sure he doesn't abuse that second chance, your information is going to come out better than the issue of assuring that I'm not trying to ask you to respond or to argue with you. There is a way we make use of the information we have it will send the wrong signal, as if to say that children now have the right to commit crime or engage in delinquent behavior that the law will not. So we need to be very careful with the way we communicate. Two, I'm beginning to question the assessment that took place that kept those people in a facility where they can escape. What it means is that those children were underrated and they escaped. That brings me to the third issue, which is very important to practice. Can you hear what I'm saying? And
I'm hearing you, sir.
can you hear me? Now,
I can hear you, sir.
Can hear you, sir.
You can now respond. Yes, any of you can now respond to I've made my observation and I've made my comment, and I hope it is clear. The third issue, which I would like you to respond is opportunity of working with Nigerian security and civil defense. Provide an opportunity for you to work with other agencies and units, for example, the police, Ministry of Gender Affairs, and any other, and some other
agency
with families.
Yes.
What do you think the social worker will bring to the table to promote interagency synergy? What do you think social workers can bring to the table to promote interagency synergy? You can respond, then we'll take another problem.
Okay. Yes, I wouldn't suggest a task force, but if there is a task force that comprises the interagencies, inclusive of the police, the women affairs, the NAPTI, the civil defense, security, and all relevant agencies, having a point where they converge every time to address issues concerning gender-based as well as trafficking and all matters that affect human, or should I call them social behaviors, so particularly on the cases of children. I think a lot will be achieved if there's a synergy, having a meeting point where they all converge to address issues, looking at the laws and looking at interventions and looking at programs across all the board. So if there's a place where they all have common ground, I think that will do a lot. It will go a long way to address a lot of issues concerning injustice across the board.
Cinderella.
Yes, sir.
Yeah. Do you have anything to say?
Yes, sir.
1 minute.
Yes. Why those children that escaped from that facility, it was because the caregiver that was there is not a social worker. So we later wrote to the ministry to make sure that it's only social workers that are supposed to be posted to such facility, and that they should make sure that the directors, they usually go for visitation to check. Because one of the children in that facility told us that when we left, that the woman was not like trying to bully the children, trying to put more panic on them. That was why they broke that window and left and escaped. Then as a social worker, my role, since when I served in that agency, my role as a social worker is to focus more on individuals' unique needs, strengths, and goals. Then also to collaborate by working with the client families and community to achieve a positive outcome. Because even at the agency, we told our supervisor that they should make sure that even if we are no longer there, they should also try and be making some kind of campaign, advocacy visit to schools, because most of the cases that we handled there was from those urban areas. So those were the recommendations that we made to the agency and to the Ministry of Women Affairs.
It's okay. Okay, you guys can take a bow. I think.
Thank you, sir. Thank you very much, sir. Thank you, sir.
Thank you, sir.
All right. Orutu Yediere Peace, are you here? Orutu Peace.
Good afternoon, sir. Good afternoon, everyone.
You're sounding as if you are angry. Can you hear me? Orutu, your dear peace. What happened?
I did my
Are you still
Can you hear me?
I can barely hear you. Okay, can you continue? Can you hear me?
Yes, I can hear you.
I can hardly see your voice. Okay, continue. I can hear you now.
Okay. Good afternoon, sir. Good afternoon, everyone. Good afternoon, doctor. I did my practicum in prompt home health care, a private health care that provides care and support to older individuals, children, people with disability, vulnerable people, and the rest. Then during my placement there, I had the opportunity to apply my knowledge and theoretical skills in a real world setting, working directly with residents, families, and care staff. I was always going to the homes to know how the caregivers are doing, to know how the client is doing, if the caregivers are doing their job, and if the clients are okay with our services. That was my work with prompt home health.
Please, can you hear me? Can anybody hear peace? Please, can anybody hear peace?
We can hear you, but the presenter, we are not hearing her again. We
Hello,
can
can you hear me?
Okay.
Yes,
Peace, are you
I'm
back?
here. I'm here. So during my hello,
Go
can you
ahead.
hear me?
Go
Okay,
ahead.
during my work there, I encountered some issues. Like one, a caregiver called that the client is abusive, the client is making them do stuff they are not supposed to do. Because whenever we want to place a caregiver, we tell them the job they are going to do there, the do's and don'ts, what they are not supposed to do and what they are supposed to do. We tell them how they are supposed to relate with their client and the rest. They should not be emotional. They should not be too they should not be too they should not be too familiar with the client no matter what. They should do their job professionally. So a caregiver called that a client was always abusive. They are always sending them to do what they are not supposed to do and the rest. And whenever the client they are taking care of is sick, the client is like the son is always telling them the son is never taking him to the hospital and the rest. So my boss was like, okay, we should write an agreement. We should take it to the client so that the client is going to sign whatever happened to his father. We are not responsible and the rest. So I was like, let's go for the visit and ask and hear from the client side before we go with the agreement. But it was like I should still go with it. So I went with it, but I didn't present it first. I have to hear from the client before I present the agreement. But when I went there, I find out that the client was actually the doctor. He was a doctor, and all the things the caregiver told us was not really true. It was because maybe she was tired of the place. That was why she was making up all those stories, because they were two. They do shifts. One comes this week and go, the other one comes the next week. So when we went, we met the other one, not the one that complained. We met with the other one. We met with the client. After talking to the client and hearing from the client, then I pulled the other one aside to hear what she has to say. But our own story was entirely different from what Mr. A told us. So I I end up not giving the client the agreement again. I went back to the office and I told my boss about what happened, what the client said, and what happened. It just the other one was tired of the place, so she don't know how to come to the office and tell us that she's tired of the place and she wants to leave. So she was just bringing up issues that were not there. So I went back to the office, told my boss, so we have to call her back to the office. So we asked her if there is anything, why is she tired, if she's tired of the job, or if there's anything going on, blah blah blah. And it was what she said, it was like family issue. Her mom was telling her not to take care of sick people and the rest and the rest. So it was her mom that was telling her not to do the job, and she don't know how to tell us and the rest. So when we find out that, so we asked her if she wants to continue or she wants to leave. She said she wants to leave, and we told her to write a resignation letter and the rest. So that was it. Hello?
So I can hear you. Can you tell me what will you
Yes,
say? What will you say is now your major experience or achievement in your place of practical?
My experience there, like I experienced a lot, and I learned a lot how to talk to people, how to settle disputes between clients and caregivers. When some, like in one case, a client just called, like she just called that she don't want the caregiver, and she didn't even give us any reason why she don't want the caregiver. So we went to the house. We asked why. She said she's telling the caregivers to do some things and the caregiver is not doing it. When we asked the caregiver, she was actually sending the caregiver to the market, and that's not her job. That's not the caregiver job. So we have to tell the woman that caregivers are not supposed to do this. Caregivers are not supposed to do this. These are the jobs that they are supposed to do. She was taking it like the caregiver was disrespectful because she's sending her to go, because we have different different stages of caregivers. They are the ones that will send to your house. They can do house chores. They can go to your messages and the rest. They are the ones. They are nurses that we send. They will just to take care of maybe your sick mother, your children, or your disabled child. They are, we have those ones. We have a plan for those ones. So the plan she paid for was the one to take care of her child, and she wants to turn that person to like a house help. So we have to explain to her that this is what you paid for. That's why when you send this person to the market, he has refused to go. It's not like he's being disrespectful and the rest. Although the client, she said she don't want that person, but we have to explain to her, and we gave her a new person. And since then, we've not had anything from that client.
Sorry, can I ask you a question? I don't really understand why you are saying we do this, the client I don't know what is the services that you are rendering in that organization.
The services we render in the organization is giving it's a private healthcare that provide care and support to people in the comfort of their home.
Okay.
Yes, we provide healthcare like doctors, nurses in the comfort of your home. You don't need to go to the hospital.
So as a sideways student, where are you placed? What exactly are you doing in that organization?
I am the social worker in the organization, so I visit the clients and the caregiver to make sure the caregiver is doing their job.
They
They
don't
are
have
not doing.
social worker in
Okay.
that organization.
No, they don't.
So which organization is that? Where is it located?
Prompt Home Healthcare is at Gariki in Abuja, Area 11.
So when you get there, you assume the position of a social worker.
No, I didn't assume. I applied to do my practicum there, and he allowed me and he employed me as the social worker too.
So you went to have a 2-in-1 service there?
Yes, ma.
Mr. Ferdinand. Mr. Ferdinand, are you there?
Yes,
I think
yes.
I think I think she
I'm
needs I think she needs to go and do a practicum somewhere else.
because from what I'm seeing, is working is like is a consultancy firm that hires people to go and run errands for families.
Hey,
You know,
that's not the type of experience you need to acquire. So please, maybe you give her 4 weeks to go somewhere else to do a practical. That's not the right place for her.
okay,
Thank
Lord.
you. Mm.
Thank you very much.
But I
So,
did the job of a social worker there.
Orotu, please, you contact me later so that you take it off from there. Olufeyi Michael sent a message to me that I should call him much later. So let's go to Adebi Christiana Ikade. Adebi Christiana, are you here? Adebi Christiana. I hope I can be heard.
Hello, sir. Good afternoon, sir.
Okay. Have you?
Good afternoon, sir. Good afternoon, sir.
I can hear you. Go ahead.
Hey. Good afternoon, sir. My name is Adebi Christiana Ikiade. Thank you for the opportunity you present to present my faith practicum experience. I carry out my practicum at the Ministry of Rural Development and Community Affairs, Abere, Oshogbo, under the Community Development Unit. My practicum started on the 3rd of June, 2025, and it ended on the 1st of August, 2025. Sir, one of the duties of the ministry I work with is to empower rural dealers to improve their standard of living, their quality of life. With that, I was privileged to be part of the team that handled the case of a vulnerable household consisting of a 33-year-old woman and her 4 children living in a semi-rural community in Osun. The case was handled at Ifewara in Atakumasa West local government. The household consists of the woman, her children, 4 of them. The first one is 10 years, 7 years, and 3rd year. The last baby is 11 months, respectively. They live in 1-room apartments with poor ventilation and leaking roof. Basic amenities. The attention of the ministry was called through the community leader due to distress and hardship. The woman worked as a laborer for others and earned very little money. She struggled to afford food. She cannot pay school fees. She cannot clothe her children and medication for her children when they are sick. 2 of the children were frequently absent from school, even though they attend public school. The children are vulnerable to educational neglect. It means that absent from school, they don't have textbooks, they don't have school uniform. The mother shows signs of stress and anxiety, feeling overwhelmed, and hopelessness due to our financial status, not knowing when or where our next meal will come from. Why the children also display signs of withdrawal, low self-esteem. They are not participating with their peer group whenever they are playing. Sign of malnutrition, sign of malnutrition in the youngest one, the last baby. During this visit, I was able to provide counseling and emotional support to the mother. My field officer and I were able to connect the family to a local NGO, Jennifer Etuk Foundation, for food support. The family were taken to the community health center in Ifewara for medical checkup. We advocated with community leaders to help with repairs of the leaking roof. The mother was also able to set up a pretty trading in front of her house. And she also joined a cooperative society. We are also doing follow-up with her, call her time to time. Sir? A role as a social worker. Being a social worker, I was able to improve my ability to coordinate small group, lead discussion, and contribute meaningfully during planning meeting. I was able to provide emotional support, if not financially in some aspects, to the people. I treated their case. I serve as a counselor, help people deal with stress and family problems. At the same point, I was opportune to educate, teach individuals about social skills, self-development, and financial planning.
Ikade, how are you? How are
Fine, sir.
you? You are okay, Abi?
Yes, sir.
Are you hearing me?
I'm hearing you, sir.
Okay. This report you gave us now, is that, did you go to that agency alone, or is that another person you went to the agency with?
I and the field officer went together. When we are doing the CDC meeting, that's the community. Okay, sir.
So there is no person in the institute that is doing practicum that you went to the agency with?
No.
Because I'm looking at this, your agency, Ministry of Rural Development and Community Affairs. I'm thinking somebody has presented something like that and was focusing on monitoring and evaluation of projects that I was trying to put an intervention that before you do that, you know the budget line, know what and what that is provided so that you know what you are monitoring. I am listening to your report. I am very convinced. When we give you a report of this nature, we expect you to put yourself in your agency, tell us what you did, not typing something or writing something down, and you begin to read it as if to say you are casting news. Even some of the way you are doing some of those pronunciations, gives me an impression that this are words that did not come out well, what it was intended to. So I was expecting you. I don't expect much from you. Very simple thing. I'm expecting you to speak to me in a language to show that you went to the field. You teach people some skills, which means you learn some skills or you have some skills, is it not?
Yes, sir.
Which skills did you teach to the household? Just give me like 1 or 2 skills that you teach to this household. I'm okay with you.
Come again, sir.
Teach people skills and self-development, is it not? That was the report you gave.
That woman I'm talking about their case. The woman that we are talking about. Sir?
How many of we, madam? How many of us went there together?
The woman I'm talking about, the woman, they have that case. When we are in the meeting of CDC, the community leader reports a case to the meeting.
Madam,
and we are doing
you did not go for any field work. You are giving us a case scenario of what happened within your community.
No,
and
sir.
they help you to write your report, and you didn't even read or master it. See, we have been here since 9 a.m. And I can see some of you going and coming, going in and coming in, even when the institute gave you the opportunity of every one of you to be on the platform. And I'm taking registration of how many of you have been going in, coming in, doing as if all the other things they have been presenting this morning is not part of you. Now is your turn to do presentation. You now carry paper. You now carry paper and read to us.
Hello, ma. I'm here since morning, since 9 o'clock that this thing started.
If you have been here since 9 a.m., you're supposed to do a better presentation, ma. Even if they write it for you. I went to this place, so these are the matters that happened there. These are my intervention. These are the things I learned, and these are the things I feel is shortcoming of the matter, and this is my recommendation. Simple. You now carry a paper and cast news to us. Please, Mr. Ferdinand, give her another 4 months, but not in that same place. You are not playing here.
Okay. Adebi Christiana Ikade, so you have to get in touch with me after now, so that we'll take it up from there.
Okay, sir.
Yeah. Olufeyi Michael, are you ready? Olufeyi Michael.
Yeah, hello, sir.
How are you?
I'm fine, sir.
Okay.
Sorry, there might be a bit of background noise, but I just had to step away from where I was.
It is necessary. You don't have a real coin.
Okay,
Or do you need 30 minutes?
Okay. No worries, sir. Let me just run through it so that I don't keep you waiting, sir.
It's all right. You have the floor.
Okay. Good afternoon, my coordinator, and good afternoon, Dr. Kemi, and also good afternoon, my colleagues. My practicum actually took place in a local council, which is a Ikorodu West local council, but I worked directly with the Community Development and Welfare Center, which is a tool or a vehicle by which Lagos State Ministry of Women Affairs and Poverty Alleviation uses to get to the grassroots. So it's more of a dual purpose office. in the sense that it works under the local council, and at the same time, it reports to the ministry. So in my 192 hours of practicum, I was able to, be involved, be a part and parcel of so many initiatives and projects. But one of those projects, which is very close to my heart and which I really, really, really appreciate learning from, was getting to learn that the social council is not just an avenue to governance and maybe contextual, building of roads or doing other things than even contributing socially to what people in a particular council, what they get in terms of alleviation, poverty alleviation, in terms of helping them socially, in terms of intervention, in terms of palliatives, and also in terms of psychological support when it has to do with the the disadvantaged people in the council. So one of the projects that I said is close to my heart is one that I worked with the counselor from the center to visit some of the primary school in the local council which had issues, especially with attendance. There was a huge absenteeism in some of the major local council primary school, and which was reported to the center. And some of the teachers were actually, working in collaboration with the council in terms of giving reports, in terms of, visiting the council to get support that range from sometimes books, sometimes giving them extra hours for them to keep the students in school and help them when they are preparing for maybe uh, primary school leaving exams, or maybe they're preparing for midterms. Those were like the support that the local council was giving through that center and through the tutelage or the supervision of the ministry. So I was able to go to Agbaro Primary School, which is in Okeoko area of the local government. And I noticed that in one of the classrooms that were supposed to have about 40-something students, only about 12 students came to school. And another one that we went to, I can't remember, I think I wrote it in the report. They had about 50-something students in one class, and about 6 only came. And out of the 6 that came, only 3 came throughout the week. The rest 3 just came that same day that we went there. So the teacher were telling us that they had problems even convincing the parents to allow the students to stay in school, because most of them complain about not having money to even send them to school. So sometimes they follow them to the market, sometimes they follow them to the farm. The place is almost a rural area. So it is just expected that you will see that young people are actually used for child labor and some other things that the law frowns at. So in that particular instance, the head of the community development and the councillor actually mandated the parents to report to the council and make sure they come with the word, so that they talk to the ward directly rather than hearing from the parents. And in the process, I was able to garner that it is not just about spending on education or by investing in infrastructure. It's almost about attitude of the parents, attitude of the society to what education is all about, and attitude to social intervention that the government can actually provide to help them to make sure they maximize all those intervention or programs that they are supporting them with. So what I was able to get from the exercise, because at the end of the day, about 15 parents came within 1 week that before I left. Most of them, the complaint they had was they did not have money to keep sending them to school. They would rather want them to do some other things outside education. But the council mandated them that, some of them were actually on some sort of intervention from the council in terms of supporting them with trades and all of that, the parents. And that was the reason why they actually created that, social intervention for them, so that they can support their children, not to just collect and at the same time still use the children to, to make money or to make ends meet or to help themselves as a family. So in a nutshell, after the whole exercise, we're able to see using some, laid down, theories and approach in terms of social work theories. One of the theories that, I actually saw firsthand was the environmental theory, which means that environment actually decides what transpires or what happens in the life of every child. In the sense that if your environment is conducive for learning and you are able to use that environment to your advantage, the results will be positive in the sense that you can actually attain that height that you have set for yourself. But if your environment limits you and does not permit you to use all the resources available to you, you will turn out bad, and which is exactly what we even saw. Some of the students were actually doing so bad that some could not even spell their names out of the ones that came back to the council to make reports. And the head of the community center told us that we're not just going to stop at those schools that we went to, that they will take you further to secondary school, although I was not there when that exercise started. But they just wanted to be sure that they are part and parcel of what is happening in all those schools in the local council. And aside that, that's one thing. Aside that, some other things that I saw during my practicum, which actually gave me a lifelong learning, is the fact that the council actually look at not just the strata of the society that can do something, but they look at those ones that cannot do anything, but they are part of the society. For instance, I'm talking about the disabled people. In the council, there is actually a ledger of all the disabled people in that local council. And the ledger is actually used to cater to their needs. Some of them come in for checkups, some of them even come in to get aids, working there, some of them even get stipends, some of them even get some jobs that are actually not conventional jobs, but they are jobs that are tailored to, to make them have some sort of normal living, to make sure that they form part and parcel of the society. And in that process, I was able to talk to a whole lot of them. And I see from their reasoning, and I see how they embrace some of the projects because it makes them feel part and parcel of the society. And that's one. And the system that I actually see with that is person-centered approach. It's a person-centered in the sense that the council, through the community development center, is not just looking at the holistic project without looking at the individual persons or individuals in that society, in that council, to see that every person is able to, perform to his best abilities just by helping them. Some just need a nudge. Some just need little help. Some just need, to bring them under the social umbrella, which is what I saw. And another thing that I saw while I was there is the issue of
Michael.
The council or the center, and through the center, reaching out to people who have issues in their domestic affairs within that council, even before they go to the police. Some of them feel going to the police sometimes might actually exacerbate the stuff or might actually give them, more problem. So they would rather just come to people they see on a regular basis, some of the councillors or some of this, and they will direct them to the center. By the time we talk to them, we will see that some of them only have problems, and those problems is now causing other problems in their houses. Like a particular lady who the husband beat at least for 4-5 times. She could not go to the police until she came to the council. And what we did, because the council as a place will not handle any. Sir?
Okay. Can you hear me now?
Yeah, I can hear you, sir.
Okay.
Hello?
I want to know. Can you hear me?
Yeah, I can hear you, sir.
I wanted to know, you worked in a local government council or a local government development authority?
No, it's a local council, but the local council has a unit under Health and Social Services, which is called Community Development Center community development and welfare center, but they call it community development center. And that
Now,
community development center is like a vehicle which the Lagos State Ministry of Women Affairs and Poverty Alleviation uses to get to the grassroots.
because listening to your reports, you are sounding like somebody that wants to read a manifesto.
I'm not reading a manifesto.
I am not against what has transpired, but my problem, let me speak so that if you are going to use the next 2 minutes,
Okay.
the way your report is coming, you are distancing yourself away from that report. What you have said is clear to me. I understand.
Okay.
You are not taking ownership of that report.
Okay, sir.
You are sounding with the way you are presenting your report.
Okay, that's just a third person approach, but I can actually just break it down. Most of the activities that I partook in were not.
Michael, the third person approach is not gonna work.
That's what I'm saying. I'm just trying to explain what the things that I saw and I partook in. But using that approach, since you feel I should go by what I did, particularly, I will mention some of the things that I did. Because number one, I was there as an an intern coming from a practicum, and most of the activities that I performed or that I did, I was only acting in support. I was not leading any process. There were other people, other specialists, other professionals who were in that center. So most of the things that I learned from were things that I saw them doing, and some of them they asked me to do. Just like, for instance, the register of the disabled people. I never knew there was a register until I got there. And when I got there, they did share palliatives 2 times, and I was mandated to write names, cross-check those people that I've received before, and make sure that I take it out. Then I point it out in the next one, which is more like an administrative function, and is not something that I took the lead. I only participated as instructed. So I learned 1 or 2 things in terms of organization, in terms of distribution, in terms of delegation, in terms of compliance to some of the things they do. So that is some of the things that I learned while I was on the practicum. And at the same time, I did a bit of counseling, especially to the parents when they came with their words. I did a lot of talking. I did a lot of, advising. I did a lot of, putting them through some checks to see why they resolve to rather have their children.
Mr. Michael, where exactly did you do all of this?
In the community center. That's what I said.
Where is the community center located?
It's in Ikorodu.
Where
I wrote it in the report. It's Ikorodu West local government.
Where is Ikorodu West located?
Is in Agric.
Ikorodu North.
No, Ikorodu West.
Central.
Ikorodu West local government.
Where did it cover?
It covered from Odogun.
Mm-hmm.
Then it cuts across Majidun, Ogolonto. It goes to Ipakodo. Then from Ipakodo, it stops very close to the General Hospital. That's the boundary between Ikorodu North and Ikorodu West. Then from there, down or back to Ibeshi. That Ibeshi Road. Then another one starts, that road going to Oluodo. Once we get to the boundary where there is this NIPCO filling station, the local council stops there. Then it goes into Agric again, to Okiopo, to Ishawu. That's the coverage of that local council.
And you now walk through all the local councils.
No,
you do
no.
Family intervention. You did palliative distribution. You did registration of
disabled people.
You disabled
Yeah,
people.
when they are sharing
You did
release material.
counseling for families too.
All in the process, three things can happen under one event. Like I said, the school that we went to is one event, but the parents came and I
Okay.
did counseling. So it's still the same event, but different times.
It's
And you
okay.
can link them together. That, okay, this is from outfall from here to this place. So apart from that, there were some other things that I did not even mention, which I saw.
The
And I learned.
family cases, are
Yeah,
you people doing it?
I couldn't hear you, man.
The family cases, are they
Yeah.
doing it in that your unit there?
No. They only referred them. They actually came to meet the counselor, the one that I saw, that I was part of. They came to meet the
So
counselor.
where did they refer them to?
We referred the case eventually to the police
So where?
because there was domestic violence involved. And after that, they referred them to the domestic violence what do you call it? Department in Lagos. Yes, they referred the case there because the police said they have the mandate that they cover. So outside that, they allow them to report cases that has involved high frequency to that particular office, and that's what we did. The only thing that we did was you know taking the case outside the council. In that
Mr.
case,
Mr. Ferdinand, please can I have his report? Please give me a copy of his report. I want to see it. Mr. Michael, I am the head of the social welfare in the whole of Ikorodu.
okay.
Whether I do Ikorodu, North, South, everything. I never see your
My report.
report. I never see even your sideways request on my table.
Request? No.
Yes,
I don't know.
the request the institute gave to you that
Okay.
you submitted at the council is supposed to be referred to us.
Okay. They
Never
never.
see it.
Okay.
So where did you submit the request to?
What request?
The one the institute gave to you to go and submit
I took it to the council.
to the council. Okay.
Yeah.
Let me have your report anyway, but then you are not all in all. All those reports you are giving is too much for an activity for
I have even
unless
I have worked on other
unless
projects outside this.
come, let me talk. Unless you are being employed to work there. Are you
Yeah.
working
Yes.
directly
I work at the council on other projects.
on another project? You are
Yes.
just talking now. So
Yes.
if you work at the council on another project, I think myself and Sir Ferdinand told you people, we have also gone to school before. When it comes to issue of practicum, it's not because you are in this class that maybe somebody wants to withdraw to know. When they say you should go for a sideways practicum, is for you to have an overview or another perspective of another operation that is not within your jurisdiction so that you can learn from there. You can also help them to interact with them, to tell them, this thing we are doing like this from the experience and the lectures we have gotten so far from the professional body. I think if we do it this way, what did you feel about it? Do you understand me now? So that is the purpose of the practicum. Look at somebody like Mr. Femi Oyedemi. He's a director with the Ministry of Youth and Social Development. But he has to leave is stable, which he officially take permission and send it to me through the ministry to overtake his duties in the office, and went for practicum for the 6 to 12 weeks. I was the one manning his table for me because I know what it takes. And he did not joke with it. He was so serious about it. He went there, and even the person that was manning that place refused to sign his booklet at a particular time. He was reporting to me. I said, leave her, she will sign it later. And one day she called and said, oh, guy, I have signed your paper, come and pick it. So if you are working in a particular place, you are advised. When we started, we told you people,
I'm not,
please
I'm not
move
working directly
to,
in that office.
wait, my dear, you're supposed to move to another place. Since you are working there, nothing is stopping you from going to a private sector to learn from how they are doing it. It won't take you
Yeah,
anything.
you're right, ma. But ma, uh, just to chip this in.
Don't be afraid. You need to just redo. You are going to redo that practicum.
Okay,
Go to a private sector.
ma, that's what I wanted to
Live,
say,
live where you are.
ma,
Go to a private sector. It
ma,
could be, it could be a juvenile issue. It could be a family issue.
ma,
Anyone you want to do,
ma.
but go to another section,
Yeah, I
not
know.
your local government, please.
No,
Not your
not
local
ma,
government.
ma, that's what I was trying to say. Not like I was working there as a staff. I was working there as a volunteer because I worked with the chairman before. So me saying I was working there was because it was a terrain that I know, and I'm a politician in the local government too. And aside that, ma, I volunteer in other areas. Even that private practice that you mentioned is a place that I've done over at least over 2 years.
Mr. Michael,
Direct involvement in most of those
Mr.
projects.
Michael,
I can show you evidence, ma.
I'm also a politician.
Okay, ma.
Go and redo that thing. It will give you another experience. That's just it. Go and redo it.
Ah,
Because
ma,
when you said
ma.
you
Should
are
I tell you
into,
something?
let me tell you, when you started to bluff to tell us you are into palliative sharing and what have you, I knew it. I know it. I am part and parcel of those places you are mentioning. If you mention my name to any local government chairman, they know it. But I only hide myself. Do you understand me now? I hide
Yes, sir.
myself. I go in a very simple way. Some of you have met me in a supermarket before, and they were like, wow, this woman, she's just walking like this, no age, nothing, nothing. Do you understand me now?
I
So
get you, ma.
please, please, eh? Please, please, with your political power, you can go to another terrain. Thank you. So let's move ahead.
Okay. Thank you very much, Dr. Kemi, for that intervention. We have so Michael, we take it off from where Dr. Kemi stopped. I think we have been communicating before now, so we'll continue with the discussion.
Okay.
Yes. Abunso one smart a wanta. Are you here?
Good evening, sir. I'm here, sir.
Federal Hospital Benin.
Yes, sir. Good evening, sir. Thank you, sir. Good evening, sir. Good evening, doctor, and good evening, my colleagues. I would first of all let me appreciate you, sir, for your time. Thank you, doctor, for being with us, for staying with us. I also want to thank this institute and Chartered Institute of Social Work Practitioners from Nigeria for for a program like this. For someone like me coming from a different area or a different profession, Practicum had made me when during the program most of the things I got there was just like theory, head knowledge. At a point during the program, I was even like, am I in the right place? Until the practicum. So I did it in Benin. My experience, I was just thinking that, okay, when I get to Benin, maybe the next day I'll go to the hospital, submit my mobilization letter, then we approve it. But fortunately, when I got to Benin, I visited the hospital, I submitted my mobilization letter. It took about 3 weeks before they could even approve it. Even the day they approved it, I was even lucky that the head of social welfare was in the administrative block. So they just say, hey, look at one of your person, do you know something? And she now said, yes, that she's been hearing of it and all of that. So that's how they just, I just started work. Even they didn't even, I just started work that day. So she took me straight to, there was a ward round already. I think it was on a Tuesday. It was on a Tuesday, sir. There was a ward round to introduce me to the medical team. So I was just there listening. So came across different cases. I think there was one case that struck me. As I said, because from somebody like me, from a different practitioner, from a different field, I used to see mental health as spiritual. I just used to see it as spiritual. Not until I began to see one-on-one experiences. And it really changed my idea about mental health. So there was one case, the very first case that I witnessed, where the doctor was attending to a young man. I think he had schizophrenia. So during the ward round, they also called the patient's relative to be there, so that anything that the person observed, any observation, any comment. So this relative was not saying that he is surprised seeing his brother, the way he's being coordinated, that he used to think that, things like this is for, that he really has lost that trust for his brother. So the doctor never advised him that these issues like this, it can happen to anybody. I think there was one movie, A Beautiful Mind. He asked the brother to go and watch Beautiful Mind, that it can happen to anybody. It can happen to anybody. So that I shouldn't worry that the brother should continue medication, that the brother will be fine. So I think that was the very first day. I think the second day I was not taking around the facility. Practicum had made me, gain a real life experience. They also have a children department, adolescent department there. That was Thursdays. Every Thursday we used to go to the ward. One of these days I also followed them. There was this child again. He also had issue of conversion and ostracism. So the mom also was even now thinking that this case is like a spiritual case. So the doctor began to educate her that no, it's not just it's not really spiritual, that he has taken the child, his son, to a lot of churches and all of those things. So when the doctor began to ask her question about how she gave birth, so she now said, yeah, there was a delay, that the baby didn't cry on time. So the doctor now said, yes, that might be, one of the causes, or he can trace the child issue to that, to that particular instance. Having seen the woman broken down, and they did not refer after their section, they not refer that to us, and while the woman was narrating her story. And I remember that I'm somebody that is really emotional, but I remember that as a social worker, I'm not supposed to be emotional. It's just an empathy. So I kept reminding myself, no, you cannot break down. You cannot break down, just like that. So, seeing the woman, because I also noticed that most of these children, it is the mother that are really doing this whole work, this whole wahala. They don't no assistance from husband or from family. So that's one of our challenge. That's some of the things I also said there, report that they cannot just live. These are special children. Even raising children is not easy. How much more, special children like this. So these are some of the things I chipped in because the place, psychiatric hospital, is a structured place, and as a student or the authority, there are things I cannot really just begin to talk because I had to follow due protocol. So I was limited, though. Even though I chipped in one of two things, like it's good why they are bringing their children for treatment. They can come with their husband, also, let's educate, the parents that this is not just an issue just for wives alone. The husbands will also have a role that they play. One of our challenges I also saw there that I think during the ward round, the doctor, they do about 80 or 85% of the jobs. There are some social challenges that social workers should have intervened, but I don't know, the way it's structured, they really don't have their input is really limited. Most times we will only do calls for referral, or we only call to remind them of their date for visitation, and all of these things are. But in nutshell, I was happy that about the experience. Even though at a point, even in the beginning, there was one time they now say they cannot even take me. I need to pay that. They even gave me that register. There's a money that the people that come here for practicum for experience like this will pay. I was I later paid, and I was really happy. It was worth it. It was worth it. Thank you, sir.
Okay.
Hello, sir.
Yeah.
Yes, sir.
Thank you very much, Abu. One. Can you, in Federal Neuropsychiatric Hospital, we have a whole lot of people there?
Yes, sir. Yes, sir.
So you are part of the people that go for ward round?
Yes, because in that ward round, yes, the social welfare department, that was the place I was attached to when I got there. We followed them, yes, during the ward round, yes, sir.
If you go for this ward round,
yes, sir,
what do you normally do?
Yes, so during the ward round, as I said before, I said is the doctor that does about 85-90% of this job. So the doctor will begin to now examine. They'll bring their file. The doctor will begin to question. He wants to find out how stable they are. So for us, most times for us, the social workers, then after referral, if the doctor needs to maybe talk to the relative, he cannot refer to us for us to call this relative for them to come, or maybe the time for them to discharge. Sometimes they can say, okay, tell them that maybe they need something, they need money, or that the child, their patient now is fine. That because they also have another place for rehabilitation. And rehabilitation is they don't force the patient. They don't force the patient to go for rehabilitation. It is the patient that will willingly say that he wants to go, or she wants to go for rehabilitation. So before they cannot refer. So for most times we are just like a bridge between the hospital and the relative. I think that's our major work there. We are just like a bridge from the hospital. When they want to contact the patient, they refer them to. And again, during the admission, the social worker, that's another area where we involve. And they also gave me an occasion for me to, admit a patient, and we used to collect 4 numbers close to the relative. And I saw that this is it's a very challenging aspect during this work, because according to the rule there, in case there is maybe they want to repatriate a patient, it is the social welfare office or social welfare that admitted that patient that will repatriate that patient. And so they are very careful, because most times psychiatry Oselu there in Benin is one of the location. I saw patient from Delta, even up to Bayelsa. So when they are discussing that, it's not easy repatriating, going back with transport, the risk. Everybody know how it is now, to travel and all of those things. So during admission, we are very careful. We're asked to take 4 numbers, and we also make sure that they are financed. Because there are some people. We also realize that there are some patients or relatives. They're just looking for a place that they will come and just dump their relative. So We are so careful. We take 4 numbers of the patient. Then we ask, just in case, if after we've discharged, does this patient have a place where the person will stay? Those are some of the questions that we ask. We also ask who will be responsible financially. So just that's part of the interview that we give, sir.
Okay, from your responses,
yes, sir.
It seems that social workers in a psychiatric hospital are running errand for the psychiatric doctors. Is that what it means?
Not really. So that's why I said it was part of the challenges, because some of the social welfare they even, I don't know if you remember the day you called. So my supervisor was there. So, she said that she was happy talking to you that they've seen like an organization or like an industry where they can also go for courses. Some of them there, I don't know some of them where they came from. You understand? So some of them didn't have like maybe not trained, so they cannot even. When the doctor, during the medical ward round, they cannot even speak. When they cite a social aspect, and so it's only one of my supervisor, one of the supervisors anyway. I'm sure because of his experience, so there are times he can interject the doctor and say, "What about why not if we go like this?" So the doctor will also want to listen from his own side or his own view. And so most times, what we were really doing there just to make us that admission, we take admission, then we follow up. Just also remind the patient relative. So time your patient will be discharged, or so time this our ward during the ward interview, they always make sure that a relative is there. They don't want to talk to a patient without the relative. So it's our duty to make sure. So I also carried out a function that there was a family that I make sure that they were around during the ward run. Yes, sir.
Okay. I came across a concept. Did you say repatriate? Is it that repatriate? Is it peculiar to those in psychiatric hospital?
Okay, yeah, that's what they use there. They will repatriate. That is, for example, if maybe now, just like what I said, maybe they are not when the hospital we're not trying to get the patient, and we cannot maybe they put fake numbers. So they will not take the social worker. Since you were the person that admitted this patient, so they are responsible, taking the patient back to the patient relative or the patient house. So that's the word they use. That's the language they always use. They will say repatriate. So that's why anytime they want to admit any patient, they are very careful. They make sure they call the numbers there. They call the numbers right there. The numbers that the person now that brought this patient. So they call the numbers to make sure, it's reachable. Just like that. And the address, we want to be very sure, because there was one time there was a patient that came. He just brought, and thank God that we have somebody that knows that area. He came to drop a wrong address. He dropped the wrong address. So the hospital and I know that we cannot, take this patient because you are not giving us the right information.
I have my reason for using that word repatriate, because it means like, I know in social work practice, we are here to learn.
Yes, sir.
For example, you have issue to do with those who abuse substance, those who have mental health challenges, those who are in conflict with the law. That is those who are in correctional facilities.
Yes, sir.
We have reintegration. Reintegration is a kind of honor return of that individual to the society.
Yes, sir. Yes, sir. When it's successful, yes, sir.
So now, with this case of repatriating, does it mean whether you achieve intervention or you did not achieve intervention, you just have to go and dump the person back?
Yes, so repatriation is when they will use the term repatriation when something now goes wrong during the process of maybe when they were during the process of intervention. So they will now use the word repatriation. Yes, sir. Yes, sir.
I'm saying if actually the social workers who are in the psychiatric hospital, we are able to make use of the resources that are within the client system. Now listen to what I'm saying.
Okay, sir.
Every client
Yes, sir.
has a system, and there are resources that are located with the client system. And
Yes, sir.
when we work with the client, no matter how difficult the situation is, we are expected to explore those resources that is within the client system to solve the client's problem. You
Yes,
have
sir.
identified probably maybe those in the social welfare in the neuropsychiatric hospital, probably they don't have social work experience or not. They are not trained social workers or they are
Yes,
not
sir.
licensed workers, which means they don't know the basic principle techniques and every other thing to employ to deliver the kind of services that is required in that environment. Do
Yes,
you
sir.
understand? But
Yes, I
if
understand.
there are trained and professional social workers in that environment, the issue of repatriation in the psychiatric hospital is not supposed to come into play because they are supposed to work with the client system, the resources within the client system, to make sure that the relatives or any other significant other of that client take responsibility of what they are supposed to do. Maybe because they don't know the right words to use or the right channel to operate so that they will make people to be responsible to the things they are doing. I may not blame you much at this stage, because you are a trainee social worker. But if I meet you in a psychiatric setting and you give me this kind of report, we begin to look for those who give you this license and begin to. The reason why I'm saying this is that so that when you are posted to a particular setting, a particular environment,
yes, sir,
is your duty to find out things social workers are supposed to do in that environment, so that you don't begin to do some guesswork.
Sorry, please, can I come in?
Okay,
sir. Okay, sir. Sorry, sir.
Now, please, let him get it right. When they talk about repatriation, it's the issue of returning somebody from one country to another. Am I clear?
Okay, yes,
very
ma'am.
clear. Yeah.
So
Very
repatriation
clear, ma.
anywhere
It is
is
transferred from state to
is an issue that has to do with a return. Even at the psychiatric center, is a return of a foreigner from a country where the foreigner is being treated to another country of where the home of the foreigner. So if they are using it in a psychiatric home, as a social worker, we're supposed to explain to them why they cannot repatriate a patient. Rather, they will return the patient. And they cannot return a patient that they have not truly rehabilitated. They will rather transfer the patient to another place that is more specialized than wherever the patient is. So please, in your report, go and make amendment to if you write repatriation there.
No, I didn't. Not as if I didn't. I didn't even. I was just
So
saying
when you
what
hear
my
them
experience.
using some terms,
Okay,
that
ma'am.
is why we
Okay,
have
doctor.
books,
Okay,
we
doctor.
have
Thank you.
dictionaries, we have Google, we have AI. If they use a term that is you don't really understand, you can write it down and tell them this term you are using is supposed to be used like this. That is why you are a professional, even though you are in the field to learn
Yes,
more.
ma'am. Yes,
Do you
doctor.
understand me now?
Yes, doctor.
So please, that term, don't use it again here. Oh.
Thank
Repatriation has to do
thank
with foreign bodies. So
thank
please.
you, doctor. Thank you,
eh,
doctor.
Okay. Thank you, Doc. Let's I'm having some 3% from Ira Specialist Hospital. So what will happen is that let me take Babatunde Joseph Adedayo. Babatunde Joseph Adedayo, are you here?
Why?
Babatunde Joseph Adedayo, are you here?
Once it's 6 o'clock, I'm leaving you people. Our agreement is from 9 to 6, which I have
Yes.
fulfilled.
Yeah. I want to take Adedayo so that the other 3% in Ira Specialist Hospital will take them together and will conclude.
It's okay, sir.
Yes. Hello, sir. I'm in, sir.
Okay. Can you take 5 minutes?
Hello, sir.
Go ahead.
Okay, thank you, sir. Good evening, Dr. Kemi. Good evening, the coordinator and my colleagues. I really appreciate the opportunity given right now to be part of the college and be part of the practicum presentation today. Yes, I did my practicum for a few months at the North Dublin Mental Health Services in Dublin, in Ireland here. And I was attached to, when I got in there, I was attached to the social work department, social work unit, because North Dublin Mental Health Services is a very big organization, and it has a lot of sub-organization working under it, because it's the HSC. So along the line, I was attached to social work unit, and I was introduced to the staff members working there as a practicum student. And they do have their own practicum student also. So in numbers are coming. So my home, it got to a time they attached me to a patient in the unit of addiction. And we had two because they put us together in pair, a lady and a man, male and female, to work with this patient. But the first challenges I faced when I got in there was my skin color, because these guys, they don't like other skin color except their own. So, but along the line, I was able to overcome the challenges of skin color, because she will be the one to go forward, while I will be the one to write the report and jot down everything we're doing for the day. So, and during the practicum, because it's not every day, we used to come twice in a week. So they send us again to another organization, which is called Peter McVerry's. Peter McVerry's deal with addiction, purely addiction, and homeless people and rough sleepers. So when we got into Peter McVerry attached us to the night supervisors. That means when the police got anybody on the street, which is on drug or alcoholic or rough sleeper, then we have the phone with us. They call us, then we come with the van to come and get them into shelter. So this is the one I want to use as my case studies. This man, we got him into the shelter, and on the third day when we report back at work, the social work supervisor asks us that, okay, this is the person we're going to work with, and we are going to do all our reports about him. So, and the guy was totally challenging. He doesn't want to see me coming around him. He doesn't want to talk to me, but was talking to the other lady. So I was lucky the day the lady didn't show up, and he had no choice than to fix everything with me. So we had opportunity to understand how they get them rehabilitated in the unit. And we had opportunity to understand how they get them settled back into the community, about their housing. We had opportunity to understand how the psychologists and the psychiatric when they visit them, how they do their medications, and what the time they have to take their medications and their depot, because they have to go for their depot, which is they have to go for blood taking every 2 weeks. So I had opportunity with them to understand all this. So there was another day which was which I needed to go with one to the St. Michael clinic to get his depot, and to get into the car with him was into the taxi was a bit difficult because he wouldn't allow me. But he had no choice; I have to go. So when we got in there, I was able to discuss with him. Then the barrier of my skin color started getting over from there. I was able to discuss with him, we chat, and when we go back to the unit, he was the one that told the supervisor that he will want Joe to be with him. Then we are able to add a counseling together. I was able to have a one-on-one discussion with him, and he explained everything to me, how he became homeless and got himself in drug. So my intervention is just a positive one, and empathy and kindness was the key word to get him settled. And another thing he did was to recommend me by himself to some of his nurses that used to come. We call them CRT. That okay, when I'm going to my depot again, or when I needed anything in the unit, let Joseph be the one to do it for me. So I'm happy about that. And another case is because they move us around as they move their own practicum students to understand everything in all the units, in all their units. So we are not based in one place. Or not Dublin Mental Health Services is the one that approve us to have the practicum done with them. So they send us to another place called St. Patrick. St. Patrick is for disabled, like person living with different kind of disability. That's for St. Pat. And when we got in there, we work with a man who happens to be on wheelchair. So that's a bit challenging because we need to use the hoist to get him. He has his own car, which is a disabled car, and he had a driver. So we need to use the hoist to get him. And that was one that I could say that I had a lot of experience by getting him up for the day. When I come in the morning, I have to get into his room, show him all his dress he's going to use for the day, try to change him, help him. In his ADL, I need to help him to do all that because the lady couldn't come in. He doesn't allow for the lady to come in. So that is on a person living with disability. And as a social worker, when my time is about a week to finish with them, because I just finished now, it's about 2 weeks now, finished with them. Yes, it's 2 weeks now. So the supervisor called me to have a discussion that, okay, your report and everything, and they used to send report also because we work in under the supervision of nurses over there. And the psychiatric doctor, when they come around them, and the psychiatric and the psychiatric doctor and the psychologist, yes, when they come and check on them. And most of their psychologists are ladies, so they want you as a man to be around when they're having their own one-on-one discussion or they are doing the assessment. So for this guy in the other unit, who happens to be the homeless, who rejected me from the beginning, was the one that got me into the room that let Joseph come in. Let's have a discussion. And he told them that, okay, he never knew Joseph could be kind to him because he's been meeting few African people who are care staffs and they are never kind to him. In fact, I mentioned him to the psychiatrist this day and the psychologist, they were there. He mentioned name of those staffs that they were not good to him, so he doesn't want to see anybody like all this color around him. So, but he really apologized, which made me so much happy, and I was glad that took place on the day. And the supervisor who had to make the report and everything said to me that, okay, you did well, though your college is not in this country, but we accept the letter sent and everything, but you did well. We will expect to see more of the students from this same college if this is the way they really teach you guys. So that was it.
Okay. Yes. Okay. Yeah. Babatunde Joseph. Okay.
Yes, sir.
From your experience, you are telling the institute to the outside world. That is a good one and very commendable.
Yes, sir.
I wanted to ask you a question, but it seems that the mechanism that worked in your system took care of it.
Yes,
But
sir.
I will still have to ask.
Yes, sir.
You've, at exception, you are working with somebody that, at the virtue of rejecting you, at a time you were able to build confidence with the
Yes,
person
sir.
and build
Yes,
a
sir.
good rapport with the
Yes,
person.
sir.
You know, your
Yes, sir.
time is as a social worker. If not for the system that moves you people around, what will you assume you are now in Nigeria and you now develop a bond? How will you go about terminating your relationship with the client, knowing that you are not going to be there forever?
Yes, sir. If it were to be home, and with the understanding and the teaching we got back from the college, it wouldn't be the same. It wouldn't be the same because we had a kind of stigma around this environment, which says even when they see us, they don't believe we are real. They still believe we are not real, especially in a system where the racism is more than what you could think of. So the only way for us to get over and to beat that the scenario is to pull yourself together and make sure they trust you in a way. Even right in schools with the children, we have to build it in a way that when they trust you, they will have to deal with you, even if you're not going to see them again, never and ever. You see, so these are the things, because part of my orientation, the time of induction, we did induction, and they waited for one lady called Mary, happens to be a Nigerian, but she's also a social worker, but she's not their permanent staff. She used to come based on whenever they have it, because she works on ladies who are pregnant. So she used to come once in a while. So they had to wait for her to do my assessment with her. So they call her in, and she told me everything. That look, here you are, is a good place. You can learn a lot around here, but you need to do much. If you have 1/10 love in you, you need to increase it to 9. If not, you won't be able to get on with them. So I was able to, I picked that up and I use it all the time. Even when they are so racist, insulting, calling me names, all these, I don't let that get on me. I don't let it get to me. I still try, because I have 6 hours with them every day. So I will try and make sure my 6 hours daily goes well.
Okay, yeah. I don't know whether Dr. Kemi has anything to say, because we're dealing with a candidate. Okay, thank you very much, Joseph, for your time.
Thank you,
Let
sir.
me, you can take a bow.
Thank you, sir.
Well done. Justice Osai-Bier. Justice, are you here? Justice.
Hello, sir. Good evening, sir. Justice is sick.
Oh, I think I got a message that
Hello?
I think I got. Yeah, it's like I got a message to that effect. I'm trying to confirm. I'll check WhatsApp. What about more say we're patient?
We are here, sir.
We are here, sir.
and work it, Patricia.
Yes, sir.
Run it right here. Right? And you are using the same gadget. Can you you either mute one so that we talk with one, we don't have that re-echo. Work it, Patricia. Essay with patience.
Yes, I want to leave so that we can use the Esegbe, sir. Thank you.
Okay. Yeah. You have you have some times to tell us what you have been doing in Practicum in your specialist hospital.
Good evening, sir. Good evening, my lecturer. Good evening, doctor. My fellow students. I'm Patience Isegbe. I did my practicum at Ira Specialist Teaching Hospital in mental health and behavioral medicine. In that department, we give In that department, we give psychosocial support to patients under the directive of our supervisor. And the role of a social worker is very key in the treatment of patients in the mental health department. In that department, we go for ward rounds on Monday, then Wednesday and Friday, we do clinic. On that clinic, we see patients with different kinds of ailments, mental health disorder, depression, anxiety, substance abuse, and so on. So on this fateful day, there was a particular case that really caught my interest. We work closely with the multidisciplinary team. So a man came with his son, about 23 years old. The boy was under the influence of substance. He was going through substance abuse. It all started when the mother died. The mother died on the day of the boy's graduation. So with that, the man felt that it was the boy that caused the mother's death. It was after the mother died that they discovered that the boy was not in school, but he did an elaborate graduation party. And it was during that party the mother slumped and died. Throughout the period, they said the mother knew that the boy was under substance abuse and he was not in school. The mother never opened up to the father. So when the father discovered, he became angry. He was not treating the boy right any longer. So from there, they were having issues. It took the man time to come out of this tragic situation. So when the man got himself back, he was now trying to seek help for the boy. That was how he brought the boy into the hospital. When the boy came, initially he felt the father is maltreating him. It wants to kill him. He wants to do all sorts of evil things to him. But with the intervention of social workers, because he was now admitted, he was left into the hospital. Anytime the father comes to visit him, becomes very aggressive, very, very angry at all. So we stopped the father from coming around. So he was now in the hospital. It took time for him to settle fully. With the interventions of social worker, we are counseling him on the need why this treatment is for his betterment. It's not that the father wants to punish him. He gradually started settling for the treatment and all that. At the end of it all, the boy was able to get himself back through counseling skills, motivational interviewing, to help him to gain what he can do for himself to make him a better person. While he was still taking the drug given to him in the hospital, he was now following the treatment and he was improving. He also got a counseling-based treatment from the psychologist. The psychologist was invited, so they started speaking to him too. The father also had some sessions with the psychologist, because before the boy was discharged, the father had to go through those sessions, made him understand why he needs to show him more love, why he needs to take care of him as his son, whatever has happened, they should restart again so that the boy will not do more harm to himself than what he has done. So after then, the boy spent like 2 months with us in the hospital. At the end of the day, when he was discharged, the discharge plan was arranged. So the boy was discharged.
And they called social workers
to
also intervene, talk to the boy.
And at the end, while it's going home, at the end of the discharge, we maintain contact with the boy. As I speak to you now, right now, the boy is learning welding. So he's becoming useful to himself, becoming a loving child. That was the follow-up we're now doing. So he's a better person.
Every time you will thank us, thank you for making me to understand what was going wrong with me. He was thinking initially that because after the father died, the mother died, the father married another wife. I remember one of these days that the boy said, "Ma, he believe is the father's second wife that don't want him to be useful." So we came in and said no. We started counseling as a social worker. We are talking to him. No, it's not like that. It's because you have engaged yourself in taking all this substance. That is why you are like this. But we promise you that so far you yield to our counseling and all you are taking your drug that the doctors are giving you, you'll be fine. So to the glory of God, we thank God that the boy is better, and we also believe that he will get better. Thank you, sir.
So one of the challenges we encounter was that the problems, stigmatization and misconception. Sometimes when they see people entering that department, they feel they are mad people, not knowing that they are not mad. Then another problem we also encounter was safety concerns. Those people that are involved in substance abuse, they're always very aggressive, very, very aggressive. Sometimes once they are angry and you are close to them, some of the nurses, they lose their phone, they just smash it on the floor. The protector of the entrance door, they will pull it off. They're always very, very aggressive. Then inadequate structure. Sometimes some patients will come for admission, they will say no bed space, and they will be asked to go or take other places around the ward, the hospital, admit them in the open ward. Then later they will now be moved back into the mental health department. Then my recommendation is that they should put more good structures, improve their increase their bed space that can take more patients. Also promote mental health awareness so that people will know about this thing really exists. Then safety in workplace, better infrastructure.
Also enhance staffing as workload distribution.
So in our conclusion, social workers play a vital role in working in the mental health department in the recovery of patients. And it gives us a unique opportunity to see real life experience in the hospital. Thank you, sir. Hello?
Yes, I can hear you. Thank you very much for your presentation and the case you've handled. I've actually been looking for your presentation. I think it's right to the point. And this the way to, it's a very good lesson, and the way you are able to handle the person. But I have my worry is you said that you have a challenge.
Your voice is low, sir.
It's tired.
Very faint.
I said,
okay.
You said that those who have mental health issues are very aggressive.
Yes, sir.
That's supposed to be a labeling.
Sir?
That's supposed to be a labeling.
And I didn't hear you.
That's supposed to be a labeling. Are you trying to label them?
No, sir.
No, sir.
Once they start getting better, they are eager to go. They want to leave the place. They want to leave the place. I want to go home. They don't want to stay again. They are also very, they are very,
very back to where they are coming from immediately. But because they will always want them to get well proper,
that they won't release them until they are stable.
It's okay. It's okay. I just want to be sure. I want to, when, in case you have opportunity of doing presentation,
Okay,
your
sir.
client,
Don't use the word aggressive. Okay, sir. All right, sir.
it is the stereotype.
Okay. Okay, sir.
As social workers, we cannot condone that.
Okay.
Even the,
Okay.
but the way I'm talking about, he faced a reaction. But he was able to as
I can't hear you, sir.
I'm saying that stereotypes and the labeling are unnecessary. You
Okay,
can't be
sir.
doing that even
Okay, sir.
Yes.
Okay, sir. Thank you, sir.
Thank you very much. I don't know. Dr. Kemi said he's going to leave by 6 o'clock. But I have one Olalere Oluwakemi. If Dr. Kemi is leaving, or in fact, let us appreciate Dr. Kemi before she leaves. Doc, we want to thank you very much for your time.
Thank you, sir. Thank you, sir.
Thank you, ma. Thank you, mommy.
Thank you, ma. Thank you, ma.
Thank you, ma.
Can you be quiet?
Thank you,
Thank you,
everybody.
ma.
Thank you, sir, Dr.
Thank you,
Moja.
ma. Thank you,
Thank you,
sir.
Dr. Louis
Thank
Kemi.
you very
Thank
much.
you
Thank
very much, man.
you.
We
Bye.
appreciate you, man.
Bye-bye, ma.
Thank you, man. Bye-bye.
Here,
Bye. Bye-bye.
yeah. While we tell Dr. Kemi bye-bye, I have one other person to do presentation who sent in his report a bit late. Olalere Oluwakemi, are you here? Olalere Oluwakemi, are you here? Olalere Oluwakemi. Just give me 1 minute to find out what is wrong. Olalere Oluwakemi, are you here? Okay, I don't know. Just give me 1 minute. Let me use the order of my line to make this call to give him that benefit of doubt. I've sent him a chat. He has not responded. Okay. Good evening, everyone, once again. Olarere did not pick his call, so we'll be coming to an end of today's presentation. It's exactly 6 o'clock. Please, the last thing before we go, I'm going to share Dio's contact email address with you. You are going to send your report and your logbook to him. Those who feel that they needed to work on they needed to correct something in their report, to please do that correction quickly. I will share Dio's email address so that you forward the soft copy of your report and your logbook to Dio. Those that were asked to go and redo their practicum, contact me after now so that we take it off from there. So good night, everyone, and have a very beautiful weekend ahead.
Good night, sir. Thank you so much.
Good night, sir.